Good evening, everyone. And I'd like to get started. I'd like to call the April 6, 2021 Committee of the Whole meeting for the Ottawa-Carleton District School Board to order and acknowledge that the meeting is taking place on unceded Algonquin territories. I would like to thank the Algonquin Nation for hosting this meeting on their land. And with that, I would like to call for a mover to approve the agenda. Trustee Blackburn, thank you very much. And are there any changes to the agenda? And seeing none, I'd like to call a question on the agenda. All those in favor? And opposed? Thank you very much, and that passes. Very good. And moving on to our next item, and that is delegations. But before I do, I'd just like to remind trustees that we have a speaker at 7:30. So if you could keep your questions brief, it would be very much appreciated. And so moving on to delegations, and our first delegation is from Mr. Drew Klein. And I would like to remind Mr. Klein that he has 2 minutes to delegate before us. So Mr. Klein, you will have 2 minutes, and at the end that you can, trustees have an opportunity to ask up to 3 questions of clarification from you. So with that, I'd like you to go ahead with your delegation. Thank you.
Thank you very much. Thank you to the educators and administrators and public health workers who have struggled through this crisis. But I rise in defense of our children and in strong opposition to the mask mandates and social distancing protocols being enforced in our schools. When doctors begin their careers in medicine, they take the Hippocratic Oath and they promise to first do no harm. OPH doctors and public health experts, it's very clear that your policies, no matter how well-intentioned, are doing harm. You're forcing masks and social distancing on an age group with a shockingly low vulnerability to this virus, and our kids are suffering physically, behaviorally, and psychologically. This practice must be stopped. Every morning as I drop my son off at school, I hold myself in contempt for forcing him to cover his face for 6 to 8 hours a day, indoors and outdoors, impairing facial recognition and identification with his peers, diminishing verbal and nonverbal communication with his friends, and disrupting emotional cues between him and his teachers. Long-term masking in children can result in increases in heart rate, nausea, dizziness, headaches, skin problems, sinusitis, vision issues, and an elevation in stress hormones that may impact immunity resilience, and so much more. The science didn't change, only the response did. This practice is doing harm, and yet look where we are again, 400 days to slow the spread. I realize I may be in the minority here. I cannot be the only person, though, who feels our children are worth fighting for. I cannot believe that our network of parents accept this fear, ignorance, and compliance that is relied upon by our politicians and public health experts to abuse their authority. Perhaps a wave of apathy has overwhelmed families, as I noted that at the most recent school council meeting, I was the only parent present. That said, I cannot accept the tyranny of the majority who are enforcing harmful mandates on our youngest and most vulnerable. The abandonment of rationality has been a predictable symptom of this failed and flawed policy. I urge you to immediately reconsider and eliminate outdoor masking policies, increase outdoor class time as the summer approaches, and begin phasing in an end to indoor masking to let our children breathe and live normal lives. We may not have much time before the harm done becomes irreparable. Thank you.
Thank you very much, Mr. Klein. And are there any questions for Mr. Klein? And seeing no further, oh, sorry. Go ahead, Trustee Fisher.
Yeah, thank you, Mr. Klein, for your delegation. Obviously, over the last year, we've heard lots about masking at different grades. We certainly understand your concerns. I guess the question I would have for you, have you made any outreach to local provincial officials or to Ottawa Public Health? As you know, they set the guidelines when it comes to the use of masks in our city, in our schools. And so I'm just wondering if you've made the same kind of intervention to local area provincial officials in Ottawa Public Health. I think it's obviously important for us to know how you feel, but it's also important, I think, for those other health experts and decision makers to know how you feel as well.
Mark, thanks. I have been trying to kind of build my way up, I guess, starting at the teacher level to the administrator level, now to the trustee level. So if you have any recommendations on how and whom I can speak with to advise them on my thoughts and feelings, I would appreciate that.
Sure. Feel free to reach out to me by email.
Thanks, Mark.
And thank you very much, Trustee Fisher. And Student Trustee Liu, do you have a question of clarification?
Yes, thanks. If you don't feel comfortable sharing, that's all right. But what are the discomforts or harms that you're seeing from perhaps your own children or the community around you?
I think for my kids, it's for my youngest son, I see skin issues, slight headaches, and psychological harm being I understand. I see him struggling with this normalization of masking. I think it's a gradual process, I believe. I think you'll start to see it even more and more become more and more prevalent. In my own kids, fortunately, we've been pretty strict in terms of how we view the masks. At least I am. And so maybe the effect on my children has been less, but I am more concerned as well about the children as a whole.
Thank you.
And thank you very much. And seeing no further questions, I'd like to thank you, Mr. Klein, for your delegation. Thank you very much.
Thanks.
And moving on to our next delegation, which is MPP Joel Harden. So go ahead, MPP Harden.
Thank you very much, Chair. Hi, everybody. Thank you for giving me some time tonight. I just wanted to, I guess you're going to get a different bookend set of presentations tonight. I wanted to give you a sense of what we're hearing from staff and parents and community members coming through our office at a time when 20 and 30-year-olds are being intubated in ICUs in major hospitals, and when the average age of someone in an ICU in our city, I was told by the mayor and officials, is 35. I respect the vigilance that this board has had in following a policy of ensuring our students and staff are safe. Although I do want to emphasize for you tonight that I am very concerned. I am very concerned at the degree to which staff in particular don't feel safe, particularly in communities where the spread of this virus is much higher. We know that this is not an equal opportunity virus. We know that this virus has been more prevalent in our cities where low-income folks and folks working in precarious employment live, and schools in those neighborhoods, to my mind, following the public health advice I've had the fortune to read, are at risk. And I fear for all of those folks. And I'm thankful, I want to emphasize that, for all the hard work being done by staff. But many people went to work today with tears in their eyes, worried about going through that front door, who are staff. And I take those concerns to heart. And I wanted to take some time out of my day to begin by thanking you for the work you do, but just to emphasize that it would be difficult for me to find a comparison in 2.5 years with the flood of communication that has come into our office from staff, from parents, and even the odd child advocating and concern. So I just want to encourage you to continue that vigilance. I'm going to keep pressuring the government of Ontario to do all it can to resource you appropriately so you can get through this moment as well as you can. But just to contrast what Mr. Klein has said, this is a very real and present threat, and I think we should carry forward with some real and present strategies.
And thank you very much for your delegation, MPP Harden. And we have some questions of clarification, starting with Trustee Blackburn. Go ahead.
Thank you, Mr. Chair, and through you. So just, and I thank you for your presentation, but do you, just to clarify, do you have an actual concrete suggestions on what we should be doing differently? I suspect you're not accusing our senior staff and at that level of not being committed to the safety of all our staff in the schools.
Thank you, Chair. Just the opportunity to respond.
Yep, go ahead.
Absolutely not. No, I actually believe the OCDSB, many acronyms in my job, I'm sorry, have the safety of all folks in the public education system at heart. What I fear, though, is that you're not resourced enough. I know in the last provincial budget, the 1.6 billion that had been allocated for COVID spending costs was set to sunset in this September. We took that opportunity to tell the government we felt that was a mistake. I think what we're dealing with right now, notably among teenagers, is a mental health crisis. 2 out of every 3 youth in the greater city of Ottawa, the experts are telling me, are experiencing some degree of mental health concern. So I think that is also, I don't have the evidence. I have the evidence for children, but I don't have the evidence around staff. I can only just tell you, Trustee Blackburn, that we have been contacted by a lot of staff who are scared to go to work today. And I think we should be, working together in unison as an Ottawa Voice, reaching out to government caucus members in our city, telling them it's time for us to resource our schools properly. Whatever decisions are going to be made, we heard the Premier presaging some potential decisions soon, but we have to make sure that people don't feel that way. Enough people felt that way coming to work today that merited me to want to come on and just flag this with all of you. So that's where I was coming from.
And thank you very much for that response. And moving on to Trustee Lyra.
Hello, MPP Harden. You sit as the critic for persons of disabilities. I'm wondering what you've heard from those communities about how the pandemic response at the OCDSB is impacting those households.
Thank you for that question. That is, in fact, the community from which we've heard the most. We know that special educators are the ones working most hands-on with students. I heard the Premier, again, presaging today a potential announcement around perhaps more support for those folks. We have been hearing nonstop from parents and students with special needs since last March about their particular challenges with online learning. I know this board has talked openly and publicly, and I thank you for it, about the need to fund special education properly. So yes, those are the folks I think in the greatest moment of need in the entire public school system. And thank you for asking that question. I think we can do even more, but again, it comes back to resourcing you properly, and we're going to keep pushing the province to make that happen.
And thank you very much for that response. And Mr. Klein, I do have to let you know that it's only trustees that are allowed to ask questions of MPP Harden. And is there any further questions for our guest here? And seeing none, I'd like to thank you very, very much for joining us, MPP Harden. I really enjoyed that information, and certainly it is very useful. And thank you again.
Thank you, Chair. Just through you to Mr. Klein, please feel free to contact us at our office. As Trustee Fisher said, we'd be happy to pick up a conversation with you. Thank you for your time this evening and for all your work.
Thank you. And how we'll proceed, trustees and committee of the whole, is we'll continue on with our agenda until just before 7:30. And if the opportunity, then we'll switch to our special guest, Dr. Edges. And I know it's not in the agenda, but I think that we do want to hear from her. Okay. And then we'll have an opportunity to ask questions afterwards. So I think that's how it's going to go. So the next item on our agenda is item 4, briefing from the chair. And go ahead, Chair Scott.
Thank you, Mr. Chair. Tonight I have 3 items. First of all, it seems like a long way ahead, but our OCDSB summer school registration for secondary students is now open. For more information, including how to register and the list of programs and courses available, please visit the Summer School in Ottawa website. There should also be links from our OCDSB home page. Secondly, April is Sikh Heritage Month. The OCDSB is proud to recognize the local Sikh community and the important contributions that Sikh Canadians have made to this country. And finally, I will close by noting that the 14th of April is International Day of Pink, a day to celebrate diversity and stand up against homophobia, transphobia, and all forms of bullying. Even though the Day of Pink falls within the April break this year, it's important for all of us to take time to reflect on what we can do to ensure that all students feel safe, accepted, and welcome in our schools. Thank you, Mr. Chair.
And thank you very much, Madam Chair. And is there any questions for the chair on her briefing? And seeing none, I'd like to move on to the next item in our agenda. And I'm going to ask if the director, if she has items that could take us to 7:30, if she could maybe talk about then or try to organize it. And thank you very much. I'm sorry about that.
No worries. So I do have my director's update. So there are some notes here. I do have some COVID update notes. I have reached out to Dr. Etches, so she may join us a little bit earlier. So we'll see how we're doing as there's Dr. Etches just as I spoke. So I think with your permission, Chair, we'll be able to flow as planned from director's updates into the COVID update as we usually do. And Dr. Etches is here to assist us. So for the director's update, April is Autism Awareness Month. The OCDSB invites you to join a virtual speaker session April 8th through to April 22nd. We have a number of speakers. The discussions focus on supporting individuals with autism spectrum disorder and also assisting families to access services. Please visit our website for further information. Group discussions continue this week as a part of our consultations on police involvement in schools and the creation of a human rights policy. Registration details can be found on our website. We have had and trustees have had questions pertaining to the 2021 graduation ceremonies. The graduation ceremonies planning is underway for the end of the year with the expectation that these ceremonies will take place in June of 2021. This year, we return to a more school-based planning for graduation ceremonies with some central support. You will note that I had made reference in an earlier update that the graduation pictures were underway earlier in the calendar year. And I'm informed that in most schools that has already been completed, as this was an important part of the process for our students. By returning to the graduation ceremonies having a more local feel with schools, it allows schools to plan with local traditions and customs in mind. Many schools have already communicated with students and families. More detailed communications can be expected by families of graduates, potential graduates after the April break. So that's all for my update. I'll pause there, Trustee Penny, Chair Penny, in the event that there are questions on that update. You're muted.
Thank you very much, Madam Director. I'm just wondering, are there any questions for the director on her briefing so far? And seeing none, I'll turn it over back to you, Madam Director.
Thank you, Chair. So I'll go ahead then with the COVID update. Over the last week, we have all watched the changing COVID landscape with concern, and that has already been raised here tonight. A rise in the case numbers in Ontario and within our own community, combined with growing understandings of increased risk of transmission with the variants of concern, has shifted the focus of our conversations. While we're still planning for September, our more immediate focus is ensuring the safety of all staff and students at the present time. Since our meeting last week, Tuesday, the following key events have occurred. The provincial government announced a 28-day emergency break period for Ontario, with schools remaining open, but increased restrictions on social gatherings and access to restaurants, retail, and recreational activities. The Ministry of Education confirmed the planned April break will continue on the week of April 12th to 16th, with additional safety measures in place following the break. The long weekend provided a much needed respite for staff, students, and families. As part of our commitment to safety, on Monday of the long weekend, other area directors of education, so the 4 directors of education in Ottawa, met with Ottawa Public Health to discuss current caseloads in Ottawa and the safe operation of schools during this week going into the April break. Chief Medical Officer Dr. Vera Etches, who is here with us this evening, advised that she and her counterparts in Toronto and Peel had written to the province encouraging a province-wide stay-at-home order. In our meeting with Dr. Etches, my colleagues and I reiterated the urgent need for school-based employees to be prioritized for the COVID-19 vaccine. Today, Dr. Etches shared a letter with all 4 area directors, which has also been shared with trustees, with staff, and with families, and which explains that the safety measures in schools have been successful and schools should remain open unless there is a province-wide shutdown. In a moment, and Dr. Etches is here, we will hear from Dr. Etches. She will speak to you directly about the public health information, including the guidance contained in her letter. I will alert trustees to the fact that Dr. Etches has been speaking since 6 o'clock this morning. Her voice is giving out on her a little bit. So given that I've shared the materials that Dr. Etches has spoken about, what I would invite you to do at this point is to, rather than having Dr. Etches repeat everything I said or repeat everything in the letters, to just turn it over to trustees to start asking questions directly. I will close with one final comment. I'd like to acknowledge how difficult this situation has been for everyone. We have heard it over the weekend. We heard it just through the voices of our delegations today. You have heard it as trustees through the variety of contacts that you have. And so we do recognize that there is a significant discomfort, emotion, fear in our community, in our schools. So we want to ensure that we're not simply blindly ignoring that reality. But one of the things is, as the leadership and stewards of our district, our job is to listen carefully. But a part of what we need to do, and I think that what is needed, and I know certainly I'm trying to do through our senior team, is to ensure that we continue to rely on evidence, rely on medical information, rely on people who do have the expertise, and making our decisions as we go forward informed by data and information, because we know that this is a very emotional time. And our goal at this point is to establish and maintain stability as we continue to move forward productively. We do need to recognize that there are a lot of conflicting pieces of information that we need to consider very carefully. I will also indicate to you that one of the things that's important for trustees to know and for our public to understand is that unlike the situation, the lockdown that occurred in January, where there was exceptions for students who had complex needs, the current situation that has been invoked in the districts where that where closure has been invoked, students with complex needs are included in the closure, and so no students are in fact in schools. And so these are part of the factual pieces of information that need to be contemplated as we continue with the conversation, because we want to ensure any decisions, any thoughts, any reflections are based on what we know factually, as opposed to drawing extrapolations from a variety of anecdotes. So at this point, Dr. Etches is in the chair, and I will turn back to Chair Penny to guide us through the remainder of the conversation, allowing folks to ask Dr. Etches the questions that they would like to do.
And thank you very much, Madam Director. And Dr. Etches, just before you begin, and I neglected to ask you this, but what time is your, how much time do you have with us this evening?
You will hear when I speak that it might be limited by my voice, but I am really interested in hearing what the questions are and the perspectives are from the board. So I'm happy to stay until everyone's asked their questions.
Okay, in that case, please proceed if you have some opening remarks in.
I really don't don't think I should spend my time talking about, to you, but rather listening to what your concerns and questions are. I mean, I think we all know this is a pretty bad time that we're in right now in terms of the kind of transmission we're seeing in our community. And so to be clear, your support would be very welcome to call for, stricter measures in the community that we need to stop the transmission of COVID, because it does appear that more is needed, and that would be one thing that I would underline.
Okay, and thank you very much, Dr. Etches, for those opening remarks. I would like to remind trustees that that we not stress out her voice too much. So, in order to get the maximum amount of questions in, and I imagine that there's a few that we try to make sure that our questions are as concise as possible. So I'm just requesting that of you. So we'll start off with student trustee Liu.
Hi, Dr. Etches. Thanks for your work as always. So I think what a lot of people are concerned about in the community right now is the fact that, at the peak of January's wave, there were around 1,700 active cases. Right now, there's around 1,800 active cases. So a lot of people are wondering why, if there are more cases in the community right now, why the recommendation for a school lockdown isn't in place. Just because I think everyone is aware, that there are harms to school lockdowns when it comes to mental health, when it comes to equity in terms of socioeconomic status. But given that rates of school transmission were low in January and are still low now, what is sort of the difference between the situation then and the situation now that makes a lockdown necessary then but not now? I hope this is a clear enough question.
I think I got it. So you're reflecting that in January, the provincial action was stay-at-home order, and it was also school closure. We actually have neither right now. So you can see we need stronger measures, right? Because you're right, it's going to take more to bring that level back down. So what I want to focus on first is that the community transmission needs to be addressed by stronger measures like a stay-at-home order. We need to have fewer businesses open that aren't essential. And for me, because school is an essential service to children, we need to keep that as the last thing to close. This is something that I have to assess every day. The situation is changing every day. So it could be that we need to get to school closures again, as well as a stay-at-home order. That is a very real possibility.
Thank you for the clarification.
And thank you very much, Dr. Etches. I'm just noting, trustees, I did put a 1-minute timer on there, and I'm hoping that you can get your question in within 1 minute. Okay, so that's what the timer is there for. So we're going to go on to trustee Lyra.
Okay, I'm going to hold myself to 2 quick questions. My first question is, what would need to have been different in Ottawa to have closed schools the way that Toronto and Peel did? Is your metric cases? Is your metric transmission rate? What is the metric that you use to decide Ottawa should stay open when Toronto and Peel, etc., closed? And then I've got one other after this.
Okay, so on your first question, we are looking at the whole context. So actually almost everything you mentioned. First of all, starting with what's going on in the community, because we know that the vast majority of people that are testing positive who are then in the school, and we find they've been positive and infectious while they've been in the school, they're coming from an acquisition that occurred in the community, and the rates are very, very connected. So as the rate goes up in the community, the number of people positive in schools goes up. So the rate is twice that of Ottawa in Toronto and Peel, more than 2 times the rate in Peel. I believe there's another school district that closed in Wellington, Dufferin, Guelph. They also have a higher rate and a faster increase in Wellington, Dufferin, Guelph than we're experiencing right now, which is not to say I'm comfortable with our level right now. I'm not. It is too high. And so then the other things that I'm considering are the school metrics. So what are the numbers of outbreaks, per population? And, again, compared to Toronto, the number of outbreaks per student population is I think, significantly lower. Toronto has 55 outbreaks today. We have 8. So it's quite different. And our level of outbreaks, the number has stayed stable over the last 3 weeks. So I'm looking to see, is that going up? Is there a rise in the number of outbreaks? And it's been fairly stable over the last 3 weeks. Whereas in Toronto, they've had to close 18 schools just yesterday. So again, pretty different scenario. And I think the other thing, which is what I was interested in talking to the directors about, was how is the school coping? How are people managing? Because it is true, there are more cohorts being dismissed right now as the number of people testing positive in schools goes up. There are more cohorts having to go home for 14 days. And how is that affecting operations and people's ability to keep teachers and school going? And I was reassured that, in fact, it's rare that a school is having to close because of lack of teachers. It is sometimes happening, but we have 369 schools, and most of them don't even have an active case. So I think that then the other thing I'm looking at and I'm aware of is how much schools bring in terms of support to children and youth and families. And certainly, concern about infection is high, and I hear that. And when schools were closed, there were a lot of concerns about that too for other health issues. So it's a balance, something we're looking at all the time. And so again, if the rate keeps going up in the community, if the outbreaks go up, if the ability to manage the dismissal of cohorts, becomes more challenging. And the last thing is our public health capacity. So are we able to investigate when someone tests positive? Are we able to get the notifications out and do that work? They have not been able to keep up in Toronto and Peel, but we are still keeping up with that work as a priority in Ottawa. So that's another difference.
Okay. My second question looks a little bit further down the road. Once the vaccine becomes available to the general population, should the school board require a vaccine for those over 8 or those over 16 to attend school? Or if a children's vaccine becomes available, should we require a vaccine for students to attend school?
I look forward to that day when there is a vaccine for children and youth. The way we've approached it with adults so far is that it's voluntary because it's new. People need some time to gather information, to see what is happening with the vaccination in the real world, to see its benefits, to have their questions answered. So I would expect a similar approach to children and youth, that we would have a voluntary approach to help people understand and encourage people to take the vaccine. We are finding that the majority of people, when they're eligible for the vaccine, that population is reaching the target. So our target is for 75% of eligible people to be vaccinated. And we passed that target for long-term care home residents and retirement home residents. For people over 90, people over 80 now, we've got 80 plus 85%, I think, of people over. So it's, and then we're now offering to people in their 70s, and we expect that that will lead to enough vaccine coverage to provide herd immunity into the future.
Okay. So to be clear, you are recommending that we do not make it mandatory once it becomes available to the general population?
Correct.
Okay, thank you.
And thank you very much, Trustee Lyra. Moving on to Trustee Scott.
Thank you, Mr. Chair. One question, and that is with regard to the forms, the COVID screening forms that our families expect and our staff are expected to affirm. Would there be any merit in adding another question to the form, which would ask whether the people could affirm that they and their families had been following the public health guidelines for COVID prevention for the previous week or 2 weeks?
Thank you. I'll take that back to the team to see it. I think what you're getting at there is that we all have a responsibility in our lives outside of schools to make sure that we're not increasing the exposure for children and youth who then are going to be going to school. And that is part of it for sure. I really appreciate you recognizing that challenge as we all get tireder, and it's difficult to keep distance always from people. I think a reminder and reinforcing that it is the time right now to stick with members of our household and not have a sleepover, not have a play date, that kind of thing. So your ask is to look at the form that people look at daily to see if we can reinforce that message.
Thank you.
Thank you very much, Trustee Scott. And moving on to Trustee Schwartz.
Chair, and thank you very much, Dr. Etches, for joining us this evening. It's always very helpful, I think, for us as a board, but also as the community to hear from you directly. So my question really is in relation to potentially other measures in schools. So after January, we now started asking for masking outdoors, for example. We added in younger cohort of kids. I'm wondering if there's additional measures that you think we need to be considering putting in place in order to keep both staff and students safe. And what comes to mind for me in particular, and I think Joel Harden asked for, or was suggesting that he's asking the province for additional resources to be given to school boards. What I'm thinking of is in fact, sort of the masks and the type of masks that are currently being used. And speaking with relatives over in Europe this weekend, I understand from relatives in Germany that cloth masks are no longer allowed in Germany at all. And so what I'm wondering is, do we need to be looking at providing PPE or masks at least at a different level than what's currently being advised? And I know that that's probably coming from Health Canada, but seeking your opinion on that and additional measures potentially in schools. Thank you.
Yeah, thank you for that question. It's a good question, and there have been studies done about how different masks function, and so it leads to our recommendation that 3-ply with a filter layer is desirable, and they have been studied head to head with surgical masks. And they're pretty comparable. So I think then some of the drivers about surgical or cloth with 3 layers are around the financial aspect and the accessibility for people. So I think that if supply wasn't a barrier, and other, more of the surgical type mask can be provided, that's an interesting thought of a strengthened measure. Again, something I can take back to the team to explore.
Thank you, Trustee Schwartz. And moving on to Trustee Bell, go ahead.
Thank you so much, Dr. Etches. I've also spent a lot of time today on the phone talking to people that are very fearful about their children going to school, and to teachers that have been affected, that have COVID right now. And so one of the questions that has come to me is, how are we applying the lessons learned? So with those COVID outbreaks that are happening, are there commonalities? Was there a ventilation issue? Was it because the PPE wasn't worn properly, or that teachers were put into a small room for lunches? There are many variables, I know, but I'd like to hear from you. How are we implementing the lessons learned on a regular basis? And I think that question also goes to the board as well. And a particular component of that is the communication component. So when we find out there have been cases linked within a school, how are we communicating with the parents? How are we improving those communications to help ease those fears and to get the facts into the hands of the people that need it? Thank you.
Yeah, so one of the big lessons learned is just what you ended with, is that actually the term outbreak causes a lot of concern and can create fear. And communication about that is really important, and rapid communication. So it resulted in us setting targets to make sure that we're communicating with people who are in the high-risk cohort within 24 hours of us learning about somebody being positive and then potentially transmission. We actually are the vast majority of time communicating actually between 4, sometimes 4 hours later, or 24 hours. So that remains our target, and through this time as well. I would say that some of the lessons learned too is that if eye protection is worn consistently, then that can enable us to deem that a significant exposure risk didn't exist, and it may help us avoid having to send educators home. So we've been reinforcing what kind of eye protection can be used. You mentioned the lunchrooms, and my understanding is that sometimes the rooms are very small for people to actually have a break and maintain 2 meters distance. So I think that that is our recommendation, is that when we see there's been transmission potentially linked to staff coming together, that we need to find ways for them to have good break space and be able to do that. Those are some of the things that we continue to emphasize.
Can I just follow up with the ventilation side point? Have we seen any issues or can we trace any cases back to improper ventilation?
That's not something that we've discovered. It's not to say that it couldn't be out there that we haven't discovered, but it's not been something we've seen.
Okay, thank you very much.
So you did ask about additional measures. Oh no, that was, I think, the previous person. In terms of additional measures, now that the weather is better, we could be emphasizing keeping the doors and the windows open more. So I think the schools know that, but maybe it's another thing we could emphasize further as the weather's better, is to keep the doors and windows open.
Thank you very much. And Trustee Bell, if you have additional questions, I can put you back on the list if you want. No? Okay. Moving on to Trustee Huff.
Good evening, Dr. Etches. Thank you very much for being here. My day has been full of data sharers. I've had more graphs sent to me today than I felt like I was back in grad school. Some of these sets of data are quite interesting, though, and so I want your reflection on them. The first one was a representation of the weekly incidence of cases in Ontario set by the population and by the school population. And it was very clear from that representation that the pattern of school cases preceded a similar spike in the community cases. Right now, the Ontario dashboard is showing that the schools and childcare settings are the predominant source of cases at this point in time. And the third piece of data that I thought was really interesting was from Thunder Bay and Sudbury, where they literally marked the transmission cases. So it was the graphic of the transmission cases where they marked the date where the schools were closed and then looked at the progression down where the numbers went down. So the question that was brought forward by my data sharers was, how are we so different from these places that we shouldn't be taking these data patterns and data trends into our own thinking at this point in time? Is the case in Ottawa so different than it is in these other areas?
Let me just reflect back, make sure I heard. So the first was that you're seeing a pattern of cases rise in students and then in the community. And the other is that the rates are higher in younger people.
Yeah.
Yeah. And the last was that when you close schools, you get decreased spread.
Yes.
So, I think there's a few things at play. What we see here in Ottawa is that in terms of the correlation that things go up first in students and then in the community, to speak to whether is that cause or not cause, that's pretty hard to prove. What we know is that students are tested more than the general population because of the daily screening. So we do see that those rates are higher because there's the testing and the screening that's done. What we do to look at where is the COVID coming from is when somebody tests positive, we ask them about their close contacts, and we look for anybody who's been positive that they've been in contact with. And the vast majority of the time, the people who are positive in school had someone in their household who was positive or someone in their social network. And it is not the case usually that there was someone in the school that was positive. So we call that the epidemiological link and the likely source of acquisition. So they're absolutely linked. The community will go up and the schools go up. They're connected populations, but we don't see evidence that the schools increase transmission. Now, when schools are closed, that is one of the measures that can decrease COVID. That's why we're thinking about it, right? That's why we're looking like, do we need to close schools? But it is also the fact that schools provide a lot of health benefits by being open, and so we have to find the balance. And if we just close schools on their own, because they're not the source of where everyone's getting infected, there's even a potential of doing harm. If we close the schools today, the malls are open and lots of places are open. And so I'm concerned that not enough is being done in the community. We need to start there and get that under control and keep reassessing. Do we also need to close schools? Because we may. And so that's that has been shown, you're right, that has been shown to decrease levels in the community then when everything's closed.
Thank you so much for those answers, Doc. My data sharers will be glad to have them.
And thank you very much, Trustee Huff. And Trustee Campbell, go ahead.
Thank you very much for coming again. Really appreciate it. Great info. I only really have one question. I know in other areas, and I guess to a certain extent, the dialogue in Ottawa has been, close or not close the schools. But it's often said Ottawa is one of the largest geographically municipalities in Canada, and there are various kinds of schools, various areas of the city. We have secondary, elementary, and all kinds of different neighborhoods and at-risk populations. In your mind, is it basically on or off? All the schools are closed or all the schools are open? Or is there a place or a circumstance wherein you could see closing a type of school or an area of the city and sort of, or is the benefit to that so potentially marginal and questionable, it's not worthy of serious consideration?
Thank you for pointing to the issue of neighborhoods that are facing a greater burden of COVID. We are mapping that and following that and trying to change that. And one of the ways we're going to be able to change that, actually, it's already started, but it's underway more and more, that will touch upon the school community more now, is that we are able to prioritize vaccination in neighborhoods where the COVID rates have been highest. And that we did start that way. Actually, I don't know if any of you would recall when we launched our immunization program, it was for people over 80 in certain postal code or neighborhoods. I think we used neighborhoods in the end. And that we're now expanding. We'll be able to get down to anybody over 50 who lives or works in these neighborhoods. So that will start to protect the school population of educators and school staff that are in these neighborhoods. So we do hope to provide additional support against COVID transmission in neighborhoods facing larger risk. And then when it comes to closing schools, I think what you're speaking about is actually our current practice, that where we see more COVID in schools, more cohorts being dismissed, not able to keep up and follow the transmission or rule things out, then schools are closed, and without having to close all 369. And so that's the current state of how we're advancing. When it comes to trying to ask people just from one part of the city to sort of stay home and close things in one part of the city, we've looked at the connections across the city between. We've actually tried to do that spaghetti kind of mapping, and it's really clear we're a pretty interconnected city. So it is in fact, we're an interconnected province. And so that's why when I wrote to the Chief Medical Officer of Health looking for stronger measures in the community to stay at home order, I asked that it would be for the whole province, because we do see the mobility between regions affects rates across the city.
Great, thank you.
Thank you very much, Trustee Campbell. And moving on to Ms. Gardner, go ahead.
Okay, thank you very much. And thank you for allowing me to ask some questions, Dr. Etches. As you well note, and you no doubt have seen, educators are very concerned at this particular point in time. We did write a letter to the director over the weekend, together, the presidents of the unions, letting her know exactly the concerns that we do have. One of the questions we have had from our members is, why is there not an immunization plan yet in terms of timeline and in terms of prioritization with regards to education workers? Will there be a prioritization in terms of those working on the front lines, those working in special program classes where students are not able to potentially mask or distance? What is the plan? That's my first question. And then if I may just add another one, we're now hearing from other medical experts and epidemiologists that the new variants are in fact being transmitted by children. Without wide uptake of asymptomatic testing, how can you be so sure that such transmission is not happening in schools, especially when students are eating in classrooms, much as though they were in a crowded restaurant? Thank you.
So your first question is about the vaccination program and timelines and plan for educators and people in the school community. So I can tell you, this is all dictated by provincial policy, right? And so on the ground, we're the local implementers. So we're looking to follow the provincial direction. What we have is a document that describes phase 2. Phase 2 of the vaccination program was just launched by the province today. And the first people that need to be protected at this point in time are people over 60 and people with the highest risk health conditions, like cancers and renal failure and transplant recipients. Congregate care settings are also some of the first sort of phase 2 populations to go forward. And this recognition that there are neighborhoods that have higher risk. And so that's also the place to start, where the age can drop down to 50. And so the timeline is set by how big are these populations that we need to work through and how much vaccine do we have. And so the vaccine that we get about 25,000 doses of Pfizer vaccine a week. And that, is going to still, we need to finish people in their 70s and in their 60s with the doses that we have now. The enumeration of people with these highest risk health conditions is underway. It's ongoing. The hospitals are recruiting people. So we'll find out how big that group is. And there are about 200 plus congregate care settings where people needing more care and support. So the neighborhoods, I think I mentioned earlier, is where we will probably first immunize educators. It's in the neighborhood-based approach, and we are doing that. We are launching that as soon as we can. We're starting in the top neighborhoods where the rates have been highest, and we'll proceed through the 21 neighborhoods that we have identified. And actually, that makes up 20% of the population of Ottawa. So those neighborhoods, the 21 are about 20% of Ottawa will be covered through that focus. You asked about special education, and so I think that is a very positive way of thinking. Is when we get the vaccine and we're at the time to reach more educators, we want to start with people who are at the highest risk. And so people who may be with children without a mask, or who have different kinds of work they're doing to support people with toileting and other pieces. So I think that is very likely something that you could see coming forward, and maybe sooner rather than later. You know, I think these conversations are happening. The plan of how we would actually reach teachers is not completely developed, but it's probably going to be the situation will probably be that teachers will have choice. They'll have choice about where they go to get their vaccine. So teachers, when they're age appropriate, they can register through the Ontario online booking system or phone. If they're already in a neighborhood, they can go through the public health booking system. We'll be announcing that very soon, how that will work. And if they're over 55, they can go to a pharmacy. Right now, AstraZeneca is available in pharmacies. And we think that some of the way forward will be to provide immunizations in schools, like using schools as a community hub. So I would expect that some teachers may be able to benefit from that, school-based approach as well. And of course, we'll need the cooperation of the school boards to use school space, but this is something I can foresee. So I think there'll be another way is possible. Again, I don't want to promise when the plan is in development, but if we have the list of all the teachers and we have that prioritized by risk according to the type of work and age is still the top risk factor here, then we have been using this list method to be able to get healthcare workers immunized at the Ottawa Hospital and the Queensway-Carleton Hospital. So this may be another approach, depending on the different populations that are being given access at a certain time. So I hope that gives you some sense that we are thinking of teachers and educators and school community. We want to get there. I think you're in the group of essential workers that comes first, and we're going to try to get there faster in the neighborhoods where there's higher risk through the neighborhood approach. And we'll continue to follow provincial direction on this. If there are any changes in provincial policy, then we'll adapt on the ground and implement as they've decided.
Thank you.
I think your second question was about asymptomatic spread, and of course this could be happening. It certainly could be happening, and we know that it's a proportion of all COVID that is asymptomatic, and so if there was a lot of spread of asymptomatic infections, we would expect some then to become symptomatic and to present for testing, and so that we would start to detect greater rates of spread. You asked that question in the context of the variants of concern. And I think it's worth talking a little bit about the variants of concern, if that's helpful. I see your head's nodding. Yeah, just one second. I'm so sorry you have to hear this. The variants of concern do appear to transmit more rapidly and cause more severe illness and in younger people. So we are concerned. It's part of why I think the rise is going up so quickly right now. And this could become more of what we see in schools. I think it's what they've seen maybe in other parts, of the GTA, where they have a higher percentage of VOCs for longer. Our percentage of VOCs in Ottawa has been lower than the GTA, but it's growing and it is taking over. It is. And so when we studied this, how are we seeing the VOCs spread in schools? We studied it by asking for all of the exposed cohort where someone tested positive for a VOC. We asked them to get tested before they returned to school, so that if they had an asymptomatic infection, we would still find it. And in fact, through this experience, we actually didn't find any greater level of transmission in the cohorts with variants of concern compared to other types of COVID. So that's our experience here locally to date, but it might change. It's something we're watching, and we'll keep watching. There have been outbreaks, due to variants of concern. There's also been variants of concern where we haven't seen the spread in the community, in the school communities. So I hope that answers your question.
Well, thank you very much. And if I can just say that, we do wonder, what the tipping point is going to be. And I think, another trustee asked that earlier. So, of course, everybody is a little bit on tenterhooks right now, but I appreciate the answers you've given. Thank you so much.
Yeah. So I'm looking at it every day. And, we have a number of variables, as I've mentioned, that we monitor. We'll be giving notice to people if we need to close the schools. We've heard that too, that people need a couple of days at least to organize childcare. But that's my commitment.
Thank you very much, Ms. Gardner. And moving on, I saw that Ms. Lamba had her hand up, but now it's down. Did you have a question, Ms. Lamba?
No, I have just a really quick question. Just about getting like asymptomatic testing in high priority zones. What do you think of that?
Right. Yeah, that's true. Testing hasn't really come up yet. We have been learning from the asymptomatic testing that's been happening of student and school populations. So what we have been doing was offering testing at a school site, typically on weekends, to school communities, neighbors as well, where we think there might be a higher risk of transmission. That approach didn't show us very much COVID. We really didn't find very much in the community. And so we find it's most useful to provide that testing capacity where we see a greater number of high-risk contacts or schools that have had higher number of people testing positive. We're going to continue to adapt it to try to provide, I'm sorry, there's just a little background noise. We're going to try to provide access to asymptomatic testing in other ways. So we're continuing this weekend. We'll have another sites available, and actually all through the spring break, we're going to make testing available. So maybe people will be, better able to come forward and be tested when the school break is happening. And we are just about ready to try something that is more like a self-swabbing approach, where the self-swabbing process is being validated, is being studied, and now we're looking at the implementation challenges and approach of how would we actually bring this to a school community? How would it work? Is it for family where there's somebody with symptoms and then they take the swab home and they make sure it's not COVID? So we're starting to be able to look at some of these other kinds of options as well.
Okay, thank you. Thank you for that answer. And another first-time speaker is Melanie Barkley. Go ahead.
So first of all, I just want to thank you for coming to speak with us today. I know as a teacher going into a classroom tomorrow, this has really helped ease my anxiety a little bit. I represent secondary vocational teachers, and the question or the concern that I'm hearing the most is about contact tracing. And occasional teachers are feeling frustrated and kind of left out to dry because they are in covering for a teacher one day, and then they find out a week and a half later that that teacher's class had a student with a case or something going on, and they had no idea that it happened. So I was just wondering, how is contact tracing happening for education workers, especially thinking of vocational teachers, but I'm sure there are others who are not permanently fixtured into a building and who maybe how do they fit into the contact tracing process?
Okay. Well, I'm yeah, we'll want to look into that if it appears that there are gaps in occasional teachers being notified. That we don't want that. For people who are positive in a school environment, we are maintaining full contact tracing. We're not able to do that for everybody who tests positive right now. Unfortunately, there are too many people. Our team has not grown. In fact, it's been hard to maintain the team as we need to also do immunization. But the intent and the work underway, as I said, we haven't let it go, is to do full contact tracing in schools, to identify all the contacts who need to be sent home. And so I think, if you have a particular situation, maybe we could take it offline to see if we could learn what happened there in terms of somebody not being identified. I believe maybe the school director could speak to it, but I think we work with the schools to really understand who's been in that cohort. So I think normally we would hear if there was a supply teacher, a occasional teacher involved, and then that would be somebody who would be contacted. Sometimes it's possible that the actual days that the occasional teacher was in the classroom were not the days that somebody was infectious. It is possible that there could be some details there.
Brett, did you want to jump in on this one too, a little bit?
Thanks. I think Dr. Etches hit on the point that the principal works very closely with the community, the COVID school support team, and the nurse to identify those people that were present during the period of communicability. Oftentimes where we have a positive case, there are no high risk contacts whatsoever. So sometimes it has not been necessary to notify the supply teacher. I can't say with the many cases that we've had over the course of the year that it is possible that perhaps an occasional teacher should have received that general letter indicating that there was a positive case in the school. But certainly, if an OT was in a position to be identified as a high risk contact, that would be those records are looked through to see who was actually in what rooms at what time. If something was missed, let us know and we'll take a look into it. Again, human error is always a possibility, but probably what's happening is some of our occasional teachers are hearing about this case. They know they were in there around the time of, but they weren't necessarily made aware because it didn't fall within that period of communicability. Thanks.
So can I just follow up really quickly? What should an occasional teacher do if they are hearing these things and think they may have been at risk, but they're not sure?
They're most welcome to contact Ottawa Public Health, and we'll cross-check with the school and see what the situation is. Yeah.
Or the principal of the school where they were assigned.
It's true. The school nurse is probably your most direct. I would say the school nurse is your most direct way into to reach us. Yes.
All right.
Awesome. Thank you very much.
Thank you very much. And we have Trustee Fisher. Go ahead, Trustee Fisher.
Yeah, thanks, Keith. And thanks for the presentation tonight, Dr. Etches. Certainly echo all the sentiments from my colleagues about having you here tonight and really hearing from you directly. I think that's super helpful. I guess the one question that I would have, most of my questions have been answered tonight, but the one that is sort of lingering in my mind is my zone covers K1B and K1T, which is 2 of the 3 hotspots that have been identified by the province in the city. You talked a little bit about sort of what some of the special focus might be on these areas of the city in terms of vaccinations and outreach. What more can we be doing as a board? What more can we be doing together with OPH to really try and target this community differently? Because it's been, these 2 postal codes have been hotspots for a while, right? And if I could just use my own daughter's school as context, she's been tested 5 times, sent home 3 times. And we pretty much see a letter every single day. And so that just kind of says to me as a parent that there's more that we need to be doing in these communities to stress the importance of the health guidelines, but to really try and control some of the community contacts and transmissions that are taking place in these hotspots. And I'm at a loss in terms of what more I can be doing in terms of vocalizing to the community, adhere to the guidelines, right? So is there anything in your mind that we could be doing differently to sort of message to this this part of the city and try and really turn that curve a little bit, because what has been sort of happening to date doesn't seem to be working, and it really worries me, both as a parent, as a trustee.
It's really hard to change some of the drivers of why people have higher rates, right? So it's hard to change poverty and precarious employment and employment that gives people more exposures to COVID. And so I can see why it's hard to change the rate, even though we have been working hard specifically to make sure people understand the COVID measures of masks. We've been providing masks, the distancing. I think there's lots for us to learn from this pandemic about how to support newcomer populations and communicating in many different languages, drawing on the leaders and experts within the community to help with communications. We are certainly really interested in using the benefits of the vaccination to actually get these rates down. And so I think your voice is about the benefits of the vaccine, to take the first vaccine that's available to you. They're all approved and safe in Canada. I think that's the key focus right now, as we're going to be able to offer vaccine to these neighborhoods now. And I think we're always open to additional messaging through schools, through school boards, through teachers, and parent councils. We're happy to work with you on that. We have increased the number of people that work as community developers in the community alongside community members to make sure that information is being shared in people's first language. We've been finding that's very critical. So I think those are some of the things, and they're big policy pieces, right? We've seen that sick leave would be useful for people to be able to stay home when they're sick, and be able to care for their children when they're sick. These kinds of things certainly, I think, go beyond a school board or a medical officer's powers, but we can highlight them.
I really appreciate that, and I guess that's where I get a bit stuck, because I know that there are a lot of communities in South Ottawa that are precarious and are being exposed to the COVID-19, not because they want to, but because they're working 2 or 3 jobs, or they're just circumstances that put them in at a higher risk. And as you said rightly, those policies, those changes extend beyond what a school board can do. But I'm really wanting to try and figure out what can we be advocating for that would truly make a difference for these communities that really need that support. And I don't have any easy answers. So yeah.
So I think as the neighborhood approach gets really rolling, because so far what we've had is pop-up clinics,
Mm-hmm.
and we're gonna have lots of things we try, door-to-door, buildings. I think you could almost have campaigns in the school about the vaccine, and it's here in our neighborhood, and this is our time, and it's going to help us end this swabbing, I hope we can actually build some energy around a neighborhood-based approach, and schools would be part of that.
Okay, great. Thank you. And thank you for everything that you've done. I think you're doing an amazing job. And I think it goes without saying, we're all behind you 110%.
Thank you very much, Trustee Fisher. And we do have a first-time speaker, Mr. Wildman. Go ahead.
Thank you very much, Chair. I just wanted to follow up on the question raised by a previous speaker about occasional teachers. Many of our occasional teachers find out by virtue of the sort of the luck that they had a second assignment in the same school where there was a positive case in a class they taught a day or two before, and they would never have heard of that case except that they happened to be teaching in the school that day. And when they ask why they weren't contacted, and it's explained to them that they weren't considered a close contact because had they been wearing both their mask and their face shield, they aren't considered a close contact. But they feel no one talked to them to see what their experience and contact with that child was. If they hadn't been in the school and didn't know about it, they would be completely missed. And if for some reason they didn't have both those protective pieces of equipment on, like they came in from yard duty with their glasses fogged up or whatever, they would be unwittingly perhaps putting their own family at risk. And as a result, the OTs are limiting their availability even more, creating all the stress and everything that goes with that when absent staff isn't replaced, and that the teachers have to cover.
Mr. Wildman, do you have a question?
So my question is, what can we do to give the OTs confidence that they're not being missed in contact tracing and only find out when they happen to be in that school close to a few days later?
Maybe I'll start, and maybe Mr. Reynolds would like to add something. Maybe something that might give more confidence to occasional teachers is we can share the procedures that we follow, the protocols that we have, that we go through to identify who would be considered a high-risk contact and who wouldn't be, so people understand the process and the variables that we consider. That could be something that we could share.
Thank you for that. We have problems with the dashboard. I think the OTs need to know more about where there was a close contact or where there was a case. Thank you for that.
Very much. And Dr. Etches sounds like she's quickly losing her voice. Are you doing okay? Can you take a couple more? Okay, thank you very much. We really appreciate that. And we have Christine Mullison. Go ahead, Christine.
Thank you, Mr. Chair, and thank you, Dr. Etches, for coming this evening to our meeting. You mentioned parent councils a couple people back, and I'm just curious what you think that parent councils can do, both as individual councils at each school and as a group collectively, to get this message out, and what you would like to see councils do to further push this message of how to keep kids safe.
Thank you. So I mentioned the parent councils earlier in the context of the vaccine campaign and being able to work together to promote it. At this point, what I think, I mean, you've heard it, you know it, but I'll just say it again. What I think would be really excellent is to work with you around helping parents understand the seriousness of the level of COVID in our community, and what will stop it is keeping to our household. And so I think some very practical examples would be great, right? So helping people understand, what can I do? Like, isn't outdoors okay? Outdoors is usually okay. But it still is going to be a risk if people are in close contact. So if we can share some practical things, like if you go to a park and there's other kids there, make sure you set up so that you have some distance from the other families. And if you're not sure that you're going to be able to maintain that distance in a park, then put on a mask. And those kind of practical things of what would really actually help families understand what's required at this point in time. I would be happy to work our team with parent councils to sort of share some of the like less risky, don't do right now kind of messages, and choose the less risky things.
That would be fantastic. And also, since I am with the group for OCAS, which is the Ottawa-Carleton Assembly of School Councils, if there is a way or if you want some help with the vaccination rollout in parent council and getting the message out, we'd be more than happy to work with you in your office and getting that out to councils for the OCDSB and making sure that the councils that are members of our group do get that, and we can promote it there for you as well within the city. Thank you.
So I've made a few follow-up notes here. I'm going to pass them on to our school team lead, fabulous Marino Francis Pillai, and he'll know how to connect back with you. Yeah.
Well, thanks a lot. And another first-time speaker is Trustee Blackburn. Go ahead.
Thank you, Mr. Chair, and through you, and I'd like to thank you, Dr. Etches, for joining us tonight. My question is about vaccinations, and kind of piggybacking on what Trustee Fisher mentioned about some of those people who live in our more at-risk communities, people who do have to leave the home to do their job. We have families whose parents work 2 and 3 jobs. They don't have the option to stay home. I myself work in logistics and am deemed an essential worker, and I cannot do my job from home. If I do not go to work tomorrow, I will not be paid. And obviously, as a trustee of many years, I have total admiration and care for the staff who work for the OCDSB. But can you talk about how you view getting other people who have no option but to work outside of the home, grocery store workers, logistics workers, and the like?
Right. So I talked earlier about phase 2, and it includes essential workers. And early on in the essential worker category, it's educators. And people who I could probably pull it up and make sure I'm referencing it properly. But all to say, I don't actually, what I want to actually make the point about, but I'll get to this and pull it up in terms of the sequencing. It's called sequencing of the essential workers. They're in 2 groups. What I think is actually the best and first opportunity for people is to be part of the neighborhood approach. So where we see people who are at higher risk of COVID, it overlaps with the essential workers. Right? So many of the communities that have higher rates of COVID, it's where people live who are personal support workers or working in grocery stores. So I actually think the first opportunity for people may be through the neighborhoods, and that may be very soon. Anyone who's over 50 will move down in the age groups as well as soon as we can, according to the provincial policy. So when I'm looking now at the phase 2 guidance document, the first group of essential workers who cannot work from home, it does include the elementary and secondary school workers, and it does include individuals working in childcare and food manufacturing and distribution workers, agricultural and farm workers. So there are some there, though later on, it's the second group where actually retail workers come, including grocery. So this is tough. This is tough that someone has to come after someone else. And so I think, the age-based approach will prevent hospitalizations and death. And then we need to focus on where the risk is highest in these neighborhoods. And I do think that we'll capture a lot of essential workers there before getting to the formal point when we say now we're working through group 2 of essential workers. I hope that makes sense.
Thank you for that. And I appreciate you don't have a crystal ball. I get that. But I guess many of the people I'm talking about, and many of the people who are parents of our kids, are well under 50. When do you anticipate that? Because that, to me, obviously getting everybody vaccinated is going to help us all, but particularly the parents of our kids too. So when do you anticipate like we're going to get like to 40, age 40?
It could be in May. It could be in May. I would say that's a real possibility. So we're trying to get to every eligible adult by the end of school, right? That's the reality. We're actually going to get there, I think, as the vaccine supply is growing. So, the picture will be different. We'll actually have protection from the vaccine before the end of the school year with the first dose, but yeah, the hard point is right now. I get it right now.
Yeah. All right. Thank you. And
thank you.
Thanks for all you do.
And we're going to go to 2 more questions, and one to Trustee Lyra and then to Trustee Huff. So go ahead, Trustee Lyra.
So my first, I've actually got 2 questions and a quick bit of community feedback. I'll start with the community feedback so you don't have to talk. There are people that I have spoken to who are concerned that not closing schools causes the general public to say, well, if they're not even closing schools, it's clearly not as important as it could be, because when they closed schools, it was more important. And I'm wondering, so that's just sort of something to think about. I don't need you to respond if you don't want to.
Oh, I'd be happy to respond. I think that is true, unfortunately, that some people are not getting a message that this is serious unless something big changes, like they can't have their children in school. It is possibly one of the reasons to close schools, is to send the message that you actually must stay home. And that's why I'm assessing it. That's why it's on the table as something that we're thinking about. And that the counterbalance is, man, the immense amount of harm that comes with that. And knowing we need people to stay home. So we need those other measures in the community as well.
So my 2 questions are, in the neighborhoods that you are prioritizing, is it people who live in the neighborhood only, or would it also be education workers who work in the school in the neighborhood but who don't live there?
So my understanding, the way I'm approaching it with the team, is anybody who lives or works in the neighborhood.
Okay. And then my second question is, we heard earlier today that the median age in the ICU in Ottawa is 35. I'm wondering, we heard that from MPP Harden, who heard it from the mayor. So now it's fourth-hand information, but that's what we heard. And I'm wondering if any consideration to change the age prioritization has gone on, or any of those conversations or considerations.
Okay, that figure seems incorrect.
Okay.
In terms of the age of people in the ICU. I have in front of me the median age of all the people who tested positive today was 34. So I think that's probably where the number is coming from. We had 176 or 78 people test positive today, and the median age was 34. So the point is, of people who are testing positive, we do see higher rates of transmission of people in their 30s. So I'll come to your question then about, I think you were saying targeting vaccine to this age group. Maybe?
It was about reprioritizing, because you've said we want to prioritize those over 50 or over 60. And if we're seeing high transmission rates in younger people, has any consideration been given to shifting to a different prioritization of by age?
Yes, we have thought about it. It's come up. There is a vaccination strategy that could focus on people transmitting the virus. And that could work in a context where the transmission was not so rapid. Unfortunately, we're in a situation with really rapid transmission where it's going to reach older adults who are at risk of hospitalization and death. And so we still need to focus our vaccination limited supply. It would also be different. It would be different if we had an unlimited supply. We'd go to those 30-year-olds. But in a limited supply, we must prevent hospitalization and death. Unfortunately, we still have people in their 60s and 70s and above who aren't protected. And so we've consciously stayed with an age-based approach, having thought about this. It's the goal to prevent those hospitalizations and deaths. And we'll reassess as we go along, as those populations are protected, as we're looking at the transmission happening and the rates of transmission, and we may adjust again. Again, it will be a provincial decision made by the province.
I understand. Thank you.
Thank you very much. And our final questions come from Trustee Huff.
I can't hear her.
Oh, she's on mute. You're
I'm
on mute.
still
Okay.
muted. I'm still muted. Just hot off the press from the email during this meeting, I have a few more questions coming from constituents. So one of them was Lyra's question about whether it was going to be just people living in the neighborhoods or living and working. So that has been a concern that's been brought forward to me as well. One of the other issues that was brought forward was that many of the teachers are saying that students are preferring to stay home for 14 days as opposed to get tested when there is a situation. And so the question becomes, do we really know what's going on in the schools if we're not getting the data, if we're not having people tested and we're not getting that data? So that's one question. And the last question would be, is there any concern or any thought being put into getting those kids who are our grade 12 kids heading off to university and possibly needing to live in residence this year? Will they be prioritized for getting some vaccinations? And could we do that through in-school clinics at the end of the school year to have them ready to go off?
Yeah, good idea. If we can get the vaccine opened up to the general population of any age before school ends, I think taking a look at those 17, 18-year-olds in the school environment makes a lot of sense. I'm going to take that back for the planning. Yep. And your other question was around, do we really know? So, I absolutely recognize we do not have the full picture of COVID in schools with our numbers, right? Because there's asymptomatic infections. Not everyone gets tested. But what I do know, based on our numbers, is that the transmission is not being driven by the schools. It's like, I can tell you, we find most people who are positive. So it would be the same for asymptomatic people. It's still coming from the community. Right? So that's the bigger risk. That is what we need to address right now across the province. And we have done some studies, right? So we have tried to increase testing where we think there might be more transmission. So we've offered testing to asymptomatic people. We haven't found a lot. With the VOC question, we tried requiring testing of everyone before they came back. We didn't find a lot, right? So I am reassured also by international studies and studies around the world that actually do reinforce that the measures in schools make a difference. And, I think appreciate all the hard work that goes into this. And the teachers have done amazing things. It's been a very tough year. And I really look forward to being able to provide them some relief with the vaccine as soon as possible.
If I can just add one last thing about the idea about the 16, 17, 18-year-olds. If we manage to get them for their first shots at the end of the school year, they would be ready for their second shots at the beginning of the school year in the fall. So if you can take that thought back to your people, that would be good.
And thank you very much for that. All trustees, thank you for your very, very illuminating questions. And And thank you very much to Dr. Etches for joining us. I'm sorry for the light drilling that you took as far as, but your answers are very, very interesting and very, very useful to us, and we really, really appreciate it. And thank you again for joining us.
I appreciate the chance to hear about the inquiries and the situation, and I'll continue to be available. And thank you.
And thank you for that offer. We'll probably take you up on that again sometime, but thank you again. So, Director, did you have any additional other items for, I guess we're just still on your briefing, but.
I'm quite confident that you don't need anything further on that. I do want to record my thanks as well, though, with your indulgence, Chair Penny, simply because, I think that what I said earlier, the importance of the leadership of our organization, helping to bring a steady hand and steady calm as a way forward. I think that Dr. Etches tonight and the questions that trustees have very carefully asked, representing the questions that they have received, has been very helpful to allow our Chief Medical Officer to be able to communicate to our public in a very scientific and informed way. So my thanks not only to Dr. Etches, but with humility, I will say appreciation to the trustees as well for the nature of the questions that you asked, because that has now allowed for information to go to our public in a manner that hopefully will help to steady our way forward in a measured and careful manner. So thank you for that opportunity.
And thank you very much, Madam Director. And right now it is 8:38. And we do have still some items, but the next one might require some discussion past break time. So I'm going to call for a very quick break to 8:45, starting right now, and we'll see you back at 8:45. Thank you. Hello, everyone. So it's 8:45. If trustees could indicate that they're back and we have quorum by just turning on your screen, really appreciate that. And thank you very much. And I was, so let's continue. I was remiss in, we did have one question for the director by Christine Mullison, which was missed by and I told her to wait till after the COVID update. But if she could ask the question, and director, if I could beg your indulgence in just helping us with that. So Christine, are you there?
I am, thank you. My video won't come on though. So sorry about that. My question is just this, even given what Dr. Etches has said, we know that some staff and trustees have decided to keep their kids home from school to keep them safer. Again, family choices, I completely get it. I've done the same thing. But I've had a lot of parents reach out, and I'm wondering, what message can I give to parents that schools are safe and kids should be going, when we know that even senior members of the board and members of the board of trustees aren't confident enough to send their kids? So what can I tell parents to make sure that they're confident sending their kids in? Thank you.
Thank you, and through you, Mr. Chair. Certainly, Christine, you hit the point very clearly when you said family choices. Every family has different circumstances that drive their decision making. I know my children are in school in person, and that's our family choice. So every family has a variety of different circumstances. There are different people in their family. There are different realities. We have families who can't stay home with their children. And therefore, I think Trustee Blackburn said it very clearly, that there's some people for whom not being able to have their children in school means that they are going to miss a day's or several days' pay. And so, again, family choices are different. So I would say that every parent has to feel a level of confidence. They need to reflect on the information that they have been given. I can't say to anyone that this is a no-risk situation. I think that Dr. Etches has indicated that it is, there are a variety of levels of risk. However, we are undertaking all the measures that we know to be effective, and we also know that we are doing everything the data rather is showing that the spread, while it is in our communities, is less. There's less transmission in schools. One of the things that I wonder about as well is, again, there are decisions about whether or not we allow our young people, our children, to go to their part-time jobs. We have to make decisions about whether or not we allow our children to play in parks, and whether or not our children are going to the mall. And so those are the kinds of things that every family has to weigh, because they're different things that inform those decisions. So I don't think that it is appropriate for me to say that everyone should be following X formula to make their decisions, nor should we be in judgment about how people make their decisions. But I do feel that the doctor has spoken to the value of school, the importance of school, and how it is that we weigh the risk over the potential harm. And we need to make decisions in the best way we can for the families that we lead.
Thank you. And the issue isn't that everyone has to make their own decision, because that's extremely important. It's more that I want to make sure parents have confidence that when their kids are stepping through the doors, that they're going to be safe. And we're seeing that, many parents and other people don't feel that way. And I want to make sure that the parents who can't take a day off, or the parents those ones have confidence that their children are safe when they go through the doors. That's where my concern lies. And the other thing that many parents have been bringing up is access to mental health resources. There's been some serious issues with kiddos who are having some serious mental health issues in brick and mortar schools. And I'm not even talking just the virtual schools. And I know the board has said that, you know, the regular pieces are there and the regular psychologists are there. But it's getting to a point with some families where they're trying to access these resources and they can't, and they're overwhelmed. Has the board put any thought into expanding that, or, giving tools to teachers to help with those aspects to make sure that the students that are coming home and are stressed and are worried have access to these tools through the board? Thank you.
Yeah, so I'm going to first ask Superintendent Simmons to comment on that, because indeed we have commented on previous occasions about what is available and how to access it. And I believe Superintendent Simmons, you might be able to expand on that. I know that Executive Officer Giroux, there has been a significant communications campaign about informing families around how to access the mental health support. So I'll start with you, Superintendent Simmons.
Thank you, and Chair, through you. Yes, we are continuing to leverage our mental health supports, our social workers and our psychologists. A lot of our work also is in mental health promotion and trying to get classroom teachers and educators who are primary supports for kids in the best position to be able to support those learners as issues emerge. Each of our schools does have a process to follow in terms of crisis intervention if something should elevate to that level. And in terms of our community health protocols with CHIO, we do have ways to access supports for students who are experiencing significant challenges. Everybody is stressed out right now, and we are focusing our efforts to make sure that we are creating psychologically healthy and safe classrooms for our students, as well as really leveraging a lot of the work that's being put into place by School Mental Health Ontario and their action kit that they have created specifically to support students in schools during the pandemic. So there are a number of things going on, but if there are students who are at a requiring a higher level of support, then a conversation should occur at the school level to access the mental health supports that are available to see if we can facilitate additional levels of support.
Okay.
Thank you. And Executive Officer Giroux, did you want to add some of the communication pieces around accessing resources? Because I do know that there have been a number of pieces that have gone out to parents about the kinds of things that they can use.
We do have quite a lengthy list of resources and supports available. We maintain that and update it regularly on our website. More recently, we've been working with Superintendent Simmons on the mental health team on a targeted social media campaign that gets the resources from School Mental Health Ontario more directly into the hands. So rather than just sharing information about resources, we've actually been pulling some of the content that is aimed at youth, mostly the jack.org content, to really give very specific ideas about strategies and activities that people can engage in to help support their mental health and well-being. We also, I think the questioner asked earlier about school councils and how they could support, and the school council speaker night series that we are currently running with pro-grant funding has a number of mental health sessions that are running, and some of those provided directly by our staff and some provided by community agencies. And we're in discussions today about whether some of those can be recorded and made more broadly available. So that's something that we'll look at. And then the last piece I would say is in terms of how school council specifically can help to reinforce that. Reinforcing what we try to do most often is to amplify the messaging that comes from Ottawa Public Health, and school councils definitely could play a role in helping to amplify those messages that we get out, and those happen on a weekly basis. So there are a few things there.
Thank you very much.
Thank you. And moving on to item 7, matters for action, report 21-026. Equitable recruitment and hiring policy, and I'd like to call a director to introduce that report.
Thank you, and through you, Chair. This I know has been awaited by trustees, and as we were aware in the fall in October, we know that the government rescinded 274, Regulation 274, with the expectation that boards create a new policy reflective of the new expectations identified by the ministry. The ministry released in February the PPM 165, which gave boards the foundation for that policy. So we do have before you, after revision, review, and consultation, a policy for your contemplation and optimistically your approval. So I will at this point turn it to Superintendent McCoy, who will take you through our process as well as the policy that we would like to bring forward for our district. So Superintendent McCoy at this point.
Thank you, Director, and through you, Chair. As the Director indicated, the policy was presented in draft form in December, and we had the benefit of feedback from trustees, which we have now incorporated into the policy. As well, since the draft policy was presented, we have again met with representatives from our principal and vice principal group and our managers, as well as representatives from each of our federations. We also presented the draft policy to several of our advisory committees, including ACE and SEAC and IAC, and had the benefit of feedback from members of each of these advisory committees. It has been to our senior staff group a couple of times, and we've had the benefit of feedback from our human rights and equity advisor, as well as other members of the equity team and our senior staff team. So as the Director indicated, we are bringing back a revised policy. Just want to highlight a few of the revisions. I think they're summarized in the report, but I think of most note is the fact that the policy has been expanded. The draft, when it was brought forward, applied exclusively to hiring our teachers, and the policy has now been expanded so that it is reflective of the district's commitment to equitable recruitment, hiring, and promotion with regard to all employee positions within the district, to create specifically a strong and diverse workforce that is reflective of the community that we serve, and not exclusively our teachers, but across all of our employee groups and at all levels of the organization. As a result, the policy has been revised to remove exclusive reference to teacher, and also in relevant places to ensure that it is expanded so that it applies to not only hiring that occurs by principals in schools, but also by other decision makers, supervisors, and managers for our central departments as well. In addition, there have been some clarifications provided. So specifically, some of the definitions have been clarified. The definition of diversity, for example, has been clarified to ensure that it reflects all of the protected groups under the Ontario Human Rights Code. As well, based on feedback that we received from trustees, the section on employment mobility has been clarified, both in terms of its now application beyond teachers, but also to clarify that it's intended to ensure that applicants from outside of the jurisdiction, from any jurisdiction, receive fair treatment in terms of our hiring policies. In addition, one of the significant gaps in the policy when it was brought forward was that there was no section on monitoring and evaluation, and we have included a section on that that is reflective of both the requirements within the PPM, but also we feel provides a good framework for staff and the board to be able to monitor and evaluate the effectiveness and progress of the policy. As well, we have included specific mention of the special programs that are permitted under the Ontario Human Rights Code. I know that there are some minor amendments which some trustees have already shared in terms of some of the corrections around numbering, but certainly happy to answer any questions and hear any additional feedback, so that, as the director indicated, we can have the policy approved. The work on the procedures is underway, and we will be engaging in a consultation with our federation partners, as well as our principals, vice principals, and managers in terms of finalizing those as well, prior to the spring staffing process, which is underway within the next few weeks. So with that, Chair, I'm happy to answer any questions.
And thank you for that. I'm just wondering, there was some comments on the policy itself, and I don't know, do we have this specific one which we are debating tonight, and can that be put on the screen?
Manager Guthrie has a Google document that shows the changes in language by section that could probably be put on the screen.
Okay. Okay. Thank you very much. And I was looking at my list, and I think I saw Trustee Boothby first. So go ahead, Trustee Boothby.
Thank you, Chair. So I was going to put the online version of the policy on the floor, because I thank and appreciate that Trustee Lyra has circulated her suggestions, but there's quite a number of them. So I was hoping we were going to be able to see the original document, and then other than the editing ones, like fixing the numbering, that we could actually work through those. So I'm not sure what we actually have in front of us right now, but I think this has embedded some, maybe all of Trustee Lyra's circulated comments. So could I get a staff comment on that, please?
If I could, Chair. So yes, the table that is presented has the text, which is the original text in the policy that was the draft policy that was posted as part of tonight's package. And in order to try and help the committee proceed through the different amendments that Trustee Lyra had identified, those are highlighted on the right-hand side. So it's really intended to try and assist with the discussion in terms of being proactive in identifying what the proposed changes might be to what was originally presented.
Okay, I appreciate that, but I guess I'm not entirely certain what I would be moving, so I will
I'll just yield my time to Trustee Lyra because I'm not exactly
Mr.
sure.
Chair, on a point of order,
Yes.
if Trustee Boothby is moving the original online draft policy, she should be able to do that, and we should be able to see that on the screen and get to the amendments when whoever wants to be making amendments is making amendments.
That's what I was thinking, that some of those amendments that were proposed were substantial ones, some of them were trivial ones. So Trustee Boothby, did you want to move the original one and then we can discuss the individual changes that were proposed by Trustee Lyra when she has the floor next?
That's right, Chair. That's what I would like to do, because as I said, there are quite a number of changes, and also a number of them are substantive. And so I think rather than just assume every trustee has had an opportunity to look at them and think about them and can quickly pivot to that document, I would like to see the, as I said, the online version on the floor. And rather than take up a whole bunch of time, I'll just thank Janice and her team for working on this, and I'll yield the floor then to Trustee Lyra and others who have changes or amendments that they'd like to table. Thank you.
Okay, thank you very much. And then moving on to Trustee Lyra, go ahead.
I really wish you hadn't done that, because I also fixed all the commas that were missing, because when people can join sentences where they'd copy and paste. And so I fixed a lot of the grammar without highlighting that. So I'd like to move that we change in point 1, there's a missing comma between transparent and the first word and. There's a missing comma after the word hiring. There's a missing.
Trustee Lyra, could we really don't have time to debate the placement of commas?
Yeah, we're doing that because that's the decision that we made by moving the original version. So we're going to debate the addition of commas because they're important.
Really?
Yes.
There's 53 people on this call, Trustee Lyra. So, okay, let's go at it then one at a time.
Yeah. There's a missing comma between transparent and equitable.
Okay, why don't we do this just to save everyone's time?
I sent it yesterday because I knew this was going to take forever. I still think that we should move the version I had, and we can discuss all the highlighted changes.
Is it possible that you can leave the grammar changes up to the manager, Giroux, and her staff, and we talk about the substantive changes in order that we have a bit more efficiency?
I don't like that. I don't like just passing things without having an actual written text of what we're planning to pass as a policy.
Okay. It appears to me that this policy then is not quite ready for prime time then, because we're going to be spending the rest of the evening talking about commas and placements of commas. So if someone, but we can certainly go through your 3 minutes of changing the commas. So go ahead.
All right. So I'd like to move that we put a comma.
Point of order.
Go ahead, Trustee Blackburn.
Thank you, Mr. Chair. I understand Trustee Evans' commitment to good grammar, but this is coming back to board. And I do trust our staff to fix commas. And if those commas didn't get fixed by board, she could fix them at board. I mean, it's now 9:15. We don't need to debate commas. You've talked about wanting to act like adults. I don't think we need to debate commas. Adults don't need to debate commas.
This is not a point of order.
Well,
yes, it's
a point of something, a point of good governance. Then
it's not really
call it whatever you want,
Trustee Blackburn, unfortunately. But so I'm going to consult with Trustee Scott a little bit on how we need to proceed. Trustee Scott, do you have any ideas?
Well, the expectation was that we would be bringing this forward to special board tonight because this is on a timeline, and we also have time-sensitive policy resolutions from OPSPA. If the board is not prepared to deal with the substantive changes this evening and leave the grammatical and typographical corrections to staff's discretion, I think that we may be able to have some limited discussion. But if we are going to deal with the policy resolutions, we need to be able to leave time for that special board meeting, which we have already agreed to hold this evening. So perhaps one possible solution would be to I think we could move to defer this and deal with the policy resolutions first, hold the special board meeting, and then proceed with debate on this. And if we're not finished in a timely way tonight, it will simply have to wait for final approval at our board meeting in April. And I will ask staff if they have any comment on that, Madam Director.
Thank you. Through you, Chair. One of the things I do recognize is that we are already past the time that we were expected to submit a policy to the ministry. That said, it doesn't preclude us from continuing on and completing our work to have that done at the end of the month with board. The other piece, though, that we do have to recognize, as the superintendent indicated, is that this is the recruitment policy that will be applied to the recruitment practice that we will be undertaking this season. And while it's not imminent, as in the next week or two, it's imminent soon. And so having the our unions as well as potential candidates have a transparent understanding of what the policy is that's going to apply to their process would be wise and equitable and fair. So that's where the timeline IM issue falls into play. My thinking, because one of the concerns that I do have around a debate around grammar is that grammar is also debatable. And so while it is that there are some who perceive some approaches to using certain types of grammar, particularly the comma, that can also dissolve into a debate. And I'm not sure whether trustees want to entertain a discussion around which stylistic platform they prefer around the use of commas and semicolons and such. So that would be my comment there. But I do just want to reflect to the board that there is a timeline piece, not necessarily as a compliance item, but one that impacts our own employees and potential employees.
Thank you, Madam Director. So I think that if it is possible to move to deal with the other action item before we get further into debate on this one, if there is a legitimate way to do that.
I have the floor and I have an idea.
Do staff have a suggestion?
Sorry, are you looking for that suggestion now or before the?
Just in terms of clarifying the process before Trustee Lyra proceeds.
Well, you have currently a motion on the floor, so you would need a motion to suspend debate and move to the next item, and then come back to this item once you were done that.
Thank you.
All right. Thank you very much, Trustee Scott, for your words of wisdom and experience. So Trustee Lara, you had an idea?
I'm going to move that we make all of the changes that I have made in the document submitted to the motion on the floor, and we can sub-amend any parts people don't like.
Okay. Do we have, so that's your motion? And
that is my motion.
All right. Do you have an introduction to that motion?
I will go through and explain the highlighted changes.
Okay.
So
Do we have the timer, please?
Go ahead, Trustee Lara.
under 1.0, I have removed the word social because I do not feel that an LGBTQ identity is social. Under 2.3, I have added immigration status because I don't believe we should be prioritizing Canadian citizens over permanent residents. I have removed an extra word under 2.9. There was the word to was in a couple of times. I have rearranged the sentence in 3.1, kept almost all of the same words. I have just made it so the sentence flows more naturally. 3.2, I have changed shall reflect the diversity of the school communities, as opposed to, I think it was increasing, shall reflect. Yeah, so I removed the word increasingly because I feel like our policy should be should exist outside of time. I don't think that we should try and pin it to like the changing diversity of the school community, because doing so implies that those communities weren't always here. I have changed 3.3 where it says, or it's listed as a second 3. It's 3.3 where it says expects. I believe we should require all staff in our employee to demonstrate capacity to understand and not simply expect it. I have done the same for what I have numbered as 3.4, which is numbered in the document as 3.2. Under 3.7, I have changed the hiring decisions must be based on providing the best possible education for all students and ensuring student safety to while ensuring student safety. I have changed 4.1 section procedures. I've removed the word for because there was a hanging, because it used to say selection procedures for teachers. I've removed the word for. Under 4.1a, we see, again, it's talking about an increasingly diverse student community. And to do so, I believe, removes the historical aspect where there have been LGBTQ members and racialized members of our student body. And to say that it's becoming increasingly diverse, I believe, removes from the historical existence of those communities. More renumbering, I switched some slashes into and ors appropriately. I've changed under its, I think it's 4.1d. I've included and cronyism. I have dropped, after further contemplation, I have removed and other sorts of favoritism. Nepotism is specifically the picking of family for prestigious positions or for hiring. Cronyism includes friends, and I think we would all agree it is just as inappropriate to hire your old hockey buddy as it is to hire your nephew. I have also changed, I rearranged that sentence under, it's the third bullet point. Under the fourth bullet point, I have changed the board to, when it's talking about hiring policies, I've changed it from professional backgrounds in the board to professional backgrounds in the district, because I believe the intention of that was to, when creating hiring panels, to draw on the lived experience of people within our district, not just on the board. And under the review section, where we go back and periodically review, I believe we should also be reviewing if we are meeting our requirements under the Accessibility for Ontarians with Disabilities Act. And that is a summary of all the changes and why I made them.
And thank you very much, Trustee Lara. And that also serves as your introduction, so that's good.
That was my introduction.
Yep. So we're moving on to Trustee Scott. Go ahead. You're on mute.
First, I have to find the right button. And I have a great deal of difficulty approving this kind of blanket amendment. It makes far better procedural sense if it is separated. And so what I would like to ask is whether it would be possible to separate the amendments that have been enumerated by Trustee Lyra and deal with each of them sequentially.
Okay, I think that is, since she has enumerated them and talked about every single one of them, I think that is technically possible, and I think that's in this table right here, so.
Thank you for that. And the second thing that I will do, which I believe is procedurally allowed, and that is to move to suspend debate and go to the next action item, item 7.2 on our agenda, and return to the debate on this item when we have completed our debate on 7.2.
All right, so that's Manager Drew, is that a debatable motion, or is it just a vote, or is it and it's not amendable?
Point of order. I don't know if it is a point of order, but can I ask if it's a point of order? We have people from the Committee of the Whole who have not been able to speak to this yet. And I know that our member from ACE is here and has a number of words to speak about. So it would be great if we could hear from them before we suspend discussion on this.
But that might be Trustee Bell, but Trustee Scott does have the right to put that motion forward. And indeed she has. And I'm just consulting Manager Drew on the particulars of that particular motion.
A motion to refer is a procedural motion that is debatable and amendable only with respect to the place and conditions of postponement.
It's
Okay.
not a motion to refer, it's to suspend debate temporarily.
Agreed, Trustee Scott. Sorry, in our bylaws, we have referral, we have temporary postponement. A temporary postponement is not debatable or amendable. Requires a 2/3 majority, and if carried, lays it aside immediately to take from the table after some other business shall have intervened. So requires a 2/3 majority and is not debatable or amendable.
Thank you.
So which one would you like, Trustee Scott, referral or temporary suspend? I guess it was. Or temporary.
I think it's the table this temporarily so that we can deal with item 7.2, after which we would return to this one. And that's assuming we have 2/3 agreeable to do that. But I think that would allow us to deal with the time sensitive thing and would still have this brought back in time for all of the members from Committee of the Whole to be able to participate in the debate and discussion.
All right, sounds good. So that it's a motion to temporarily suspend, or what was the terminology, Manager Drew, again? Sorry about that.
Sorry, I'm having trouble unmuting. In our bylaws, it's a temporary postponement.
Okay, so a motion to temporarily postpone this item till we can deal with item 7.2 A and B. So we need 2/3 to pass this. And so it's not debatable and not amendable. And so can I have, can I call a question on this?
Can we use the electronic voting, please?
Yeah, Manager Guthrie, is that possible?
Yes, it is. I'll just need a moment to set the vote up.
Okay.
Sorry, my internet is giving me some difficulty. It will definitely be faster to record the vote.
Okay, I'm just going to record. The trustees who have their hand up. So if trustees, so go ahead.
Through you, Mr. Chair, my reading of the bylaws for a temporary postponement requires only a majority vote.
Manager Drew.
Sorry, just to make sure we're looking at the same section. Looking for the section number. Section 12.10 H sub 4, right on the table, temporary postponement.
Page 23, yes, that is.
Section 12.10.
Section 12.10 H 4, to lay on the table a temporary postponement.
Correct.
Requires a 2/3 majority.
Yeah, it requires 2/3 majority. So if trustees could, I've recorded who has their hands up. So if everyone could put their hands down, and we'll have an old-fashioned vote on a motion to take on item 7.2 before this one because of the time constraints. So all those in favor of temporary postponement. And opposed. And abstaining. Okay, so that passes. So that means that we're going to move on to item 7.2, notice of motion, opposite policy resolution, Trustee Boothby. So I'd like to call upon Trustee Boothby to introduce your motion. Go ahead.
Hey, thank you, Chair. So these are two resolutions to go before OCSPA's AGM. And so the first one here is on gap closing. And so we know that in the provincial budget, it has recognized the longevity of the effects of COVID. Also, the minister noted that we need to invest in student success for tomorrow. And we have many students that have experienced new or worsening learning gaps and mental health challenges as a result of the many challenges related to COVID. So we need to have immediate identification and immediate capacity and resources to address both the learning gaps and the mental health challenges that we're going to see in children starting school in September. Right now, our teachers and our mental health workers have full plates. We don't have any excess resources to be able to address these concerns and these gaps. And we need to make sure that we're getting to children in a timely fashion, and we're not asking them to wait for either learning support or mental health support. So you have the whereases and the resolution before you. I do apologize, a bad cut and paste job on my part. The first paragraph under therefore be it resolved needs to be deleted. That doesn't have anything to do with this particular motion. So I'd like to put this on the floor with that particular sentence deleted.
Thank you very much, Trustee Boothby. And we do have Trustee Lyra, go ahead.
So I agree with everything in this motion except the word recommend and advocate. I really think it's time that we begin to shift our language to stronger language. I think OPSPA could reasonably demand that the Ministry of Education do something, because they haven't listened to our recommendations, they haven't listened to our advocacy, and I think it's time that we shift to stronger language. So I'm not going to move that as an amendment. I'm just going to suggest to other folks that we might want to consider that and leave it up to someone else if they think it's important enough to move. That was all.
Okay. Thank you very much, Trustee Lyra. Is there any additional comments or questions on this? And seeing none, it's back to Trustee Boothby. Go ahead.
Thank you. And I do appreciate your concern, Trustee Lyra. And I mean, we advocate as strongly as we can. I'm not sure that demand will get us much further. I mean, we're not really in a position that we don't hold the purse strings, but I hear what you're saying. And we'll certainly, Trustee Penny and I will certainly advocate very, very strongly around the OPSPA table that we impress upon the Crown how important this is. So thank you.
Thank you very much. I'd like to call a question on this motion. Do we have that in electronic form, Manager Guthrie?
Yes, we do.
Okay, and you can see it's on your e-scribes right now.
Chair, the motion that we're voting on still has the first paragraph in there under therefore be it resolved. Do we need to remove that, or do we just understand it's removed?
I think we've, for the sake of expediency, I think everyone knows that that's cleared out, and that's. So for those trustees that may not have their e-scribe functioning at this point in time, if you could just send your vote to Manager Guthrie via private chat.
Through you, Mr. Chair, still waiting for Trustee Huff and Trustee Ellis.
Okay, and that passes unanimously. Thank you very much. And moving on to item 7.2, anti-racism data research funding. Trustee Boothby, go ahead.
Okay, thank you. So again, this will be brought to the AGM in June. And there is a government requirement that will be brought in fully January 1 of 2023 to collect and analyze anti-racism or race-based data. This is very important work, and it's a very worthwhile goal of understanding who our students are and families are and how we can address the needs of our community. The data works better with consistent collection, analysis, and trend observation. And that same group of people can then consider tweaks to the type of data that we need to collect and how to collect it. School boards in Ontario are understood to be very unique, and data collection use needs to reflect the uniqueness and the needs of each school board. This can't be left to a centralized group or a series of one-off consultants doing this work and then trying to string together cohesion and good observations. So school boards are currently using their existing data capacity on other provincial or local important initiatives and we can't afford to have these important pieces of work be pushed into the future or put on hold so that we can address this provincial need. So you have the resolution there, which is essentially asking for funding up to two full-time equivalent research officers for school boards to use in the best way for their school board. It's asking for these to be temporarily for this coming school year for an additional grant to include this funding, and then for thereafter for it to be included in the GSNs.
All right, and is there any questions? Trustee Campbell, go ahead.
Thank you. No question, but I did want to make the point to really congratulate Trustee Boothby for the preceding motion and also this one, and really her dedication putting these together. We can't continue to accept new mandates and new requirements from the ministry without the addition of staff. Our quality and performance and research staff are already fully tasked. The more that the ministry keeps adding to the pile, that means we can't pursue in DSB research projects. While we may feel stressed, I can just imagine the plight of smaller boards that don't have big core departments. So this kind of measure is really, really important. The ministry has to hear that they can't keep piling requirements on boards without funding following it. Thank you.
Thank you very much. Trustee Scott, go ahead.
Thank you, Mr. Chair. Just to say that research is one of the really key components here. There's not a lot of point in collecting a lot of data if you don't have the ability to analyze it properly and put it into the broader context of what is happening, so that you can actually make use of it to determine what changes are necessary in your practice or your policies. And I mean, we've heard for decades about let's do more evidence-based decision-making. But in order to make good use of the evidence, we need to understand it. And that's where the research component comes in. It has been sadly neglected in Ontario school districts for far too long. And it's about time that we had some proper fund to make sure that we actually have the capacity to do the kind of data analysis that we need in order to understand how best to serve our students.
Thank you very much. And seeing no further hands up, I'm going to turn it back to Trustee Boothby.
And thank you for that, Trustee Scott and Trustee Campbell, very well said. And I just also like to make sure that I acknowledge the significant contribution of Joan Orcheski from the Reid Department in developing this. I mean, she pretty much wrote the motion with her helpful comments to me, and also Mike Carson for making sure it all hangs together. Thanks.
Thanks very much. And if we could like to call the question on this, if Manager Guthrie has that available on eScribe, I'd like to call a question. Thank you. And that was passed. Thank you very much. Unanimously. So then moving back to item 7.1, matters for action, report 21-026, equitable recruitment hiring policy. And I think that I have a former list here of Trustee Scott, Ms. Lamba, Trustee Jenkins, Trustee Campbell, Trustee Ellis, and Ms. Barkley. And so I think, Trustee Scott, you still have some time. Now we have a motion on the floor that has had the 10 changes from the original text that Trustee Lyra put forward, and that is currently the one on the floor. And so I think you do have some time left, Trustee Scott. So
I believe we actually first need a motion to lift it off the table and resume our debate on this.
okay, and are you putting forward such a motion?
Yes, I am.
Okay.
I
And
think
would
this one
imagine-
also takes 2/3.
Okay. And I imagine that this one is also not debatable nor amendable. So I'd like to call the question on that. We'll just use a show of hands, I guess, is the easiest way. All those in favor of resuming debate on this motion? Thank you very much. And opposed? And abstentions? And seeing none, we are resumed on this item. So Trustee Scott, I don't think you have 3 minutes, but I think you have, what I remembered is you have about 1.5 minutes left. So
Excuse me, Chair, just for clarification, so I know where we're at on this. We're now speaking to the amendments that Trustee Lyra proposed. Is that correct?
my call on this is that, sorry, not my call. My understanding is that Trustee Lyra put forward the motion with all the changes already embedded in them.
No, Trustee Boothby put the motion forward.
Trustee Boothby moved the original. Trustee Lyra moved an extensive amendment that incorporated all of the substantive changes. And I requested that we deal with the amendments ad seriatim. In other words, one at a time.
Okay, if it pleases the trustees, we can probably look at every single, we can look at them all in serial, if that's okay with everyone. It's not really according to our normal procedure, but I think that is probably the most efficient way to go.
Well, but we can,
sorry,
we can debate the amendments.
Yes.
When we vote on them, we will vote on them individually. Is that my understanding? Am I correct?
I think it's probably clear if we debate, then vote on each amendment. Isn't that clear, Trustee Ellis?
Well, you're going to deal with each change that Trustee Lyra has proposed as a separate amendment. So we're going to go through and debate each one. That's fine. Sure.
I think that's the only way to go, because there's some that some people like and some that some people don't like, and we're not all agreed.
Could we get on the screen the first one? That's
let's
because that's the first amendment that we're going to be debating. Great.
Yeah, we got to eat this elephant one bite at a time. So, Manager Guthrie, if you could get that, if you could put that table that you had back on the screen.
And
But
Chair, the framing of this whole thing has been disturbing me from the beginning. Commas can make changes, and millions. There have been court cases where millions of dollars depended on a comma. So, this frivolizing the importance of making sure that we get this policy right, because this is an extensive policy. This is, hiring of our staff. Rushing this through. I'm uncomfortable with this whole process. I'm uncomfortable with the framing that you're putting on these amendments that Trustee Lyra has brought forward.
I was only talking about the fact that some of them are trivial, and some of them.
I'm sorry, none of them are trivial. They may not have the same impact, but this is a policy that's going to impact hiring of students. So I'm, please watch your language is all I'm asking. Try to stay neutral.
All right, already noted, Trustee Ellis. So So let's talk about the commas. So where is the first one? That's having something to do with, that was the item with.
I still think the
Social, was
best
it?
way to deal with this would be to ask Trustee Boothby if she'd like to remove hers, put mine on the floor, and then go through and do all the substantive changes one at a time.
But that's not how we have to deal with this, Trustee Lyra, because if you put yours on the floor, you're moving it with all those changes inside, and then we're going to have to disassemble it one by one. If we debate them one by one by disassembling it one by one.
Yeah, I think I still have the floor, Mr. Chair.
You do.
And I
Mrs. Scott?
believe that the first substantive amendment that Trustee Lyra made related to removing in the item 1.0 objective that she wished to remove the word social preceding the word identity at the very end of that paragraph. Am I correct?
That's the first one that I had highlighted in the document. The first one is the comma missing between transparent and the word and.
Okay, does that comma, is that friendly?
The comma?
If it's not friendly, please tell me right now.
I don't understand the reason to insert the comma. It was perfectly clear without the comma.
Okay, so that it's not friendly. Okay. So our first debate on this amendment is the comma. And our members think that a comma is important. And so we're going to talk about Trustee Lyra's comma after the word transparent. And is there anyone, Trustee Blackburn, do you have a comment on that comma?
Thank you. Thank you, Mr. Chair, through you. I'd like a staff comment on the comma. It's my understanding that before the word and, a comma is not required.
Thank you, through you, Chair. That would be my use. My typical use is that in a list, I would use a comma through each word in the list. And the last word before the and would not have a comma, followed by the and then the last word in the list. That is how I have typically written, and I have not till now been corrected on that.
Thank you, Madam Director, for that. And that is also how I was taught, and perhaps you and I are of a different generation than the person who moved it. Thank you.
Thank you very much. Trustee Booth, you go ahead.
Hi, Chair. I hate to be really obnoxious about this, but I can't even tell from what we're looking at where this comma is. That's part of my confusion and frustration with this is I appreciate Trustee Lyra's amendments and that she circulated some of them, but I didn't see the comma anywhere. And I just think if we're going to get through this quickly, we have to see where these are, or it's going to be a 10-minute debate on each of them trying to figure out where they are. So I'm not sure how it's best to proceed with that, but right now I'm completely lost as to which comma we're talking about here.
The comma is between the word transparent and in the first sentence.
Thank you. So are we placing
debating
it?
the existence? We're debating the existence of this comma.
Okay, so the motion is to remove it.
The motion is to add it.
Well, it was, okay, let's take it that way. Yes, the motion is to add it.
Thank you.
Thank you. And Trustee Campbell?
Yeah, thank you. Mr. Chair. I guess it goes to whether the concepts of transparent and equitable are seen as tied together or not. If they're merely part of a list, I would prefer the comma, since we're talking commas. If they're tied together as concepts, you shouldn't have a comma. If it's part of a list, I believe for clarity, you should have a comma. The problem with this sentence is it's two lists, right? It's a list of attributes and then a list of practices. So it's a sort of an awkward double list sentence. Personally, I prefer the comma, but it's not the kind of thing that I decided to highlight. I appreciate the concern with it. I don't think $1 million will turn on this one, but I guess if we're debating it, I prefer the comma.
All right. Trustee Lara? You're muted.
Thank you. I see Trustee Bell has asked that we take a short recess. Is that something we can do?
I think that is probably a very wise idea.
Okay.
Mr. Chair?
Yes?
And can we get since we're talking about millions of dollars apparently, or whatever, can we get a legal opinion on all of these commas?
I would.
We
I'd
did have
like
a
to
staff
concur-
comment.
Sorry, guys. I'd like to concur with Trustee Blackburn here. If we're going to be debating commas, I would like to hear from legal experts as to whether the comma makes any legal difference or not. It is a legal expert that we require at this point to provide direction on this. Period.
Madam Director?
I'm sorry for the point of order. I'm very sorry, but can the point of order be to take a short recess, determine the most efficient and effective way? Otherwise, we will be determining
No, I
many
understand
commas.
you want to take a recess. I agree, but if we're going to take a recess, then we need to get the appropriate information. And what I want to know, I want a legal opinion about these commas, and I apparently another colleague agrees with me.
Let's take a
So if we're
short
going to have a
recess.
recess, make it worthwhile, so we don't have to have another recess.
I'm going to call a short recess of approximately 5 minutes to find out how we best can proceed with this because it is time sensitive and we're not moving forward very well. So it is 9:52. I want to see everyone back here at 10 o'clock. Meanwhile, I'm going to meanwhile, we're suspending the meeting. However, I want to remain on Zoom and talk to Trustee Scott and the director and to Manager Drew to find out how we can move forward with this. So. All right, so let's go back into Committee of the Whole. And I think Trustee Scott, you still have maybe 30 seconds
I
left.
wasn't the last one with the floor. I think that was Trustee Blackburn. And if Trustee Blackburn is done, then if you recognize Trustee Schwartz, she could then move to defer the item to a special committee of the whole to just deal with this particular issue. And then we can finish our agenda and get on and do our special board.
All right, sounds good to me. So we're going to reconvene our Committee of the Whole, and Trustee Blackburn, I think you did have the floor, so.
Oh, I'm done.
Okay. Trustee Schwartz, did you have something to add?
I will move to defer.
And
as suggested by Chair Scott.
So a motion to defer is debatable on time and place. And so any ideas on that, Trustee Schwartz?
Trustee Scott just suggested for I believe, a special committee of the whole.
On April the 20th?
That sounds fine to me.
All right, sounds good.
Staff, Lynn is trying
Date to be determined.
Date to be determined based on staff coming back with the cleaned up.
I'm pretty sure we have a PD session on the 20th.
Right.
So it's date to be determined then. All right, so the motion on the floor is to defer this item to a date to be determined. And is there any debate on that? Trustee Huff, you still have your hand up there? No?
No, I'm
Okay.
just a doof.
All right, and is that, Manager Drew, is that a majority or is that a 2/3? I think it's a majority, right? So all those in favor of deferral, just put your hand up.
Hang on, we had a speaker.
And the speaker that Trustee Bell was referring to will have the opportunity to voice their opinion, their concerns, their questions at the special committee hall where this item will be deferred. So, and not all those opposed of deferring. And thank you very much. That passes. So this item is deferred. And Manager Drew.
Mr. Chair, I suggest that anyone with comments on the document provide them to board services at their earliest convenience, and so that we can review all of those comments and provide them with the backup.
Okay, thank you very much. And note that, trustees, if you have comments, if you have questions, if you have concerns, to provide them board services as soon as possible. All right. Moving on, report from statutory and other committees. I'd like to call for a mover to confirm the Advisory Committee on Equity minutes of February 25th, 2021. Trustee Bell, thank you very much. Are there any errors and/or omissions? Seeing none, I'd like to call the question on that. All those in favor? And opposed? And thank you very much. That passes. Item 8.2, Special Education Advisory Committee of March 3rd, 2021. All those in favor? I'd like to call for a mover to confirm the Special Education Committee Advisory minutes. Trustee Ellis, thank you very much. Are there any errors and/or omissions to those minutes? Seeing none, I'd like to call the question. All those in favor of receiving those minutes? And opposed? Thank you, and that passes. Now moving on to matters for discussion. Report 21-020, Universal Screening Tool Exploration and Update. Go ahead, Madam Director.
Thank you, and through you, Mr. Chair. This is a report that has been brought back as it had been shared with trustees earlier, however, not able to reach the point of discussion. And so we have brought it back as we believe that it is an item that trustees would be interested in discussing and asking questions. And so we do have with us Superintendent Simmons and Assistant Principal Hannah, who are going to take us through the report and take questions should you have thus. So Superintendent Simmons, please.
Thank you very much. I believe Dr. Plouffe is in the waiting room waiting to come in. There, so Dr. Plouffe has arrived. So in addition to Amy Hanna, we are also joined by Dr. Cheryl Plouffe, who is our lead psychologist with the gifted portfolio, who's been doing a lot of work. As the director mentioned a few months ago, we brought forward a report offering some of our initial exploration into universal screening, and we made the commitment then to come back regularly and provide updates. So we're back now, and we want to share the thinking and the learning that has gone on so far, and hear the discussion as we get towards the end. Trustees will recall that universal screening is rooted in addressing issues of underrepresentation as it's related to gifted education and gifted identification, rather. But it's potentially a really good tool for many students in terms of identifying early on individual learning profiles, potential learning challenges, and informing educators in making instructional decisions as they go about planning and the curriculum for the students. So we have taken that approach as we've worked to understand and learn more about universal screening. And in the interest of time, I'm going to turn it over quickly to System Principal Hannah and Dr. Plouffe.
Thank you. And through you, Chair, some of the information that's already been shared is around universal screening tool and how we're really looking to address the underrepresentation of gifted learners, but also all learners. And so we do believe that in providing a universal screening tool in the OCDSB, it might be an opportunity for us to not only identify our gifted learners who oftentimes are not only learners with giftedness, but have a variety of other exceptionalities that are part of their profiles. And so they tend to have a real sort of a diverse and unique profile and learners that we need to be serving. So the intention is to better sort of find opportunities for us to be learning about those students, but also really addressing that notion of missingness. And that is that piece around the fact that what students are missing from our information and how we can best serve them across the district. So what's very important is we wanted to highlight some of those key considerations around equity. And we really believe that this is an opportunity for us to be further allowing other students who may not be identified as having or being put forward to have screening and the method that we have at the current time to be put forward through a universal screening tool. And we really believe that it would be that opportunity to reduce barriers and provide equal access to screening, as well as it would include opportunities for some of our minoritized or racialized students and those of lower socioeconomic status. Throughout this report, you can see that we've done a lot of work across the province, and we've done a jurisdictional scan where we had an opportunity to liaise with a variety of different districts across the province. Obviously, some of those that we often look as comparator districts to ours. And you can see that there are a variety of districts that use a universal screening tool as one of those key pieces to look at students and their profiles and how to best serve them. And as you can see, oftentimes, and the majority of them are using it at that grade 4 point where they're using the universal screening tool, but sometimes they're also using them at that grade 3 level as well. Some of the themes that we have come out of that environmental scan are really around that time of year when we would offer a universal screening tool for students. That grade point, of course, is a hot topic, a theme that we would need to be reviewing. And of course, there are those post-universal screening considerations for follow-up. So once we have some information about learners, how would we be furthering to unpack those pieces? How would we be supporting those students in their different learning environments and contexts? And as well, we have different considerations for multidisciplinary teams and their purpose and how they would be surrounding that information and either digging deeper into that information and supporting school teams in providing different resources or different types of diagnostics that might need to be further considered. And finally, another key emerging theme was around professional development and how that would go about for different staff who would be administering the universal screening tool, et cetera. So those are just sort of some key aspects that are in our initial review and information that we wanted to report back to all of you. I'm going to turn it over to Dr. Plouffe to give us a bit of a historical perspective on the screening tool and some considerations that have gone into its selection. So I'll turn it over to you, Dr. Plouffe.
Thank you. So as written
in the memo. Basically, the CCAT has been used in the past. So prior to 1999, and then all the way up until 2007, the CCAT was administered universally to all grade 3 students. And it really, it was the main piece of information that was used in order to determine a formal identification of giftedness, according to the Ministry of Education definition. Now, sometimes the WIAT, so academic information, was also gathered to kind of complement the scores from the CCAT. And then after 2008 or 2008 onward, universal screening was discontinued. However, the CCAT was still being used based on nomination or referral basis. And that was again used to look at formal identification for giftedness. And beginning in 2014, there was additional emphasis on multidisciplinary teams and using the information from the staff working with the student to inform information about referrals for giftedness and identification of giftedness. And at this point, I think we would really like to broaden the use of the CCAT moving forward and use it not just as one piece of information, but in the context of other information. And also with the newer versions of the CCAT, they have a really nice, what they call ability profiles, which link directly with instructional strategies. So we can really use it more for programming for all of our learners, rather than kind of the more narrow use of it in the past for strictly kind of gifted identification. And so when, when looking at the options for selecting a tool, it's quite complex. There are a lot of considerations that we have to think about when we're selecting a tool. There are several tools that we looked into, and the CCAT was definitely one that had several advantages over some of the other tools. Primarily, it offers Canadian norms, which is a big advantage for our use. And also it's a multi-dimensional test, which means that it looks at several different areas, including nonverbal abilities, verbal abilities, and quantitative abilities. And some of the other tests didn't offer that flexibility. So there's definitely a lot of advantages, but we still want to continue exploring this tool, especially in terms of how we use the data and how we use the information once we gather the information from this tool. So we're still kind of in the beginning phases, but definitely the CCAT does have many advantages. In addition, they've also, in their newest revision, so the CCAT 7, they do have they've taken steps to address issues of equity. So for example, they've removed verbal prompts and replaced them with many visual prompts, for example. They've really tried to take a look at some of the language in terms of the item development. So things like removing colloquial terms, for example, and then also providing recommendations and the flexibility of how the scores are used and different composites for English language learners, for example. So there's some advantages there as well. The other part of this is just looking at, like I said, how we're going to use the information. And one of the things we also want to explore in a little more depth is this idea of local norms. And really, local norms are a way that we look at the scores. So it's percentile ranking of a student compared to all other students, but within a school. So with the CCAT, we have what are called national norms, or a comparison of how a student does compared to all students in the country. But we can also look at how does a student perform compared to other students in that building. And so that flexibility in terms of how we interpret the data is another potential advantage for us when we're looking at this information that we gather. So there's still lots to be done, but some promising outcomes so far.
Thank you, Dr. Plouffe. And just to sort of summarize, as you can see, there's lots that we're still gathering information, and we would suggest that putting together a project team for the variety of departments that we have in our district to come together to continue to explore and work through some of these pieces. And we have a variety of continued exploratory activities listed for your review there between now until the end of June of this year. And then we hope to come back with some more information to share with all of you. And I'll turn it back over to Peter Simmons.
Thank you, Amy and Cheryl. And so as we've learned, the tool has evolved over time, and it's one additional step moving forward in terms of getting towards personalization and precision in meeting student needs. So as Amy mentioned, we are going to continue to provide updates. But we do would very much want to answer any questions you have. If you have any additional factors that you think we should be considering, and as we move forward in this work, we'd love to hear from you. So back to you, Chair.
Thank you very much, Superintendent Simmons. And we do have a speakers list, and it starts with Trustee Scott.
Thank you, Mr. Chair. I'm mindful that we still have a special board meeting ahead of us, but I did want to express my huge appreciation for the consideration of using local norms if we adopt a universal screener. This is something that has been done in a number of other jurisdictions in North America with some very promising results in terms of equity issues, because in looking at the profiles of all of the students in a school where a significant number of students may be disadvantaged in one way or another, it has been one method, using the local norms, of ensuring that those children who have differences from the other kids like them are recognized, and their abilities are explored more thoroughly, so that you see more of them nominated into gifted programs, and they've had some very good results. So I think that's a really encouraging thing, and I hope that staff will continue to pursue the idea. Thank you.
Thank you very much. And Trustee Ellis, go ahead.
Thank you. It's regretful that we're again to spec ed issue at the end of our meeting and don't have as much time, so I'll get right into it. On page 53, it speaks to some of the Canadian norms and other things you can do. Way back last term, when the extensive gifted and universal screening report was brought to us, it mentioned that some jurisdictions were able to, had decided to, say for Native Americans, because I think it was an American study, they had less of a lower score that would still get them into the gifted. It was mentioned by Dr. Plouffe about ELD. Is that the same sort of thing where we can, if we decide that for this group to qualify for congregated gifted, they would need less of a score than a Canadian-born student, say?
Thank you. And through you, Chair, just before I turn it to Dr. Plouffe, we are not at the position yet of having made those decisions or being able to make those commitments. But certainly there are conversations going on around that equity piece as it relates to various students and their backgrounds. But Cheryl may have some additional info.
Yeah, and just to add to that, definitely there's considerations around our ELD and ELL learners for sure. And I think we also, we have to think about the programming, right? And the fit between how are we identifying and then the programming options as well. So there's definitely, it's very complex and there's a lot to consider. Okay. So yes.
We're short on time. Thank you. That answers my question. It's still on the table. My next is on page 54, and it's about the project team, and it mentions groups. It doesn't mention federations. I see later that you're consulting with federations. Is that going to be the sort of extent, or will the federations have will have a presence throughout this? Maybe not as formal, but will have their voice will be heard beyond just consulting, or is it just the consulting?
Through you, Mr. Chair, we do have a vested interest in working with our educator partners in helping to understand their perspective as it relates to this. So Amy may have an additional piece here, but we do plan to engage them in conversations around how this might be used to support educators. As we are still going through our research portion, we haven't made the decisions yet on exactly the direction we're going to go. We're just continuing to explore, but yes, Federation partners are key in this work.
Good. I had no doubt that was the case. I just wanted to highlight it and find out. On page 54, it's the listing of milestones. And for the February 31st to May 21st, you've got an advisory committee consultation. You just have SEAC. I understand why it's SEAC, but part of this is a equity issue. So I would like to suggest that you consider IAC and ACE as well, or at least see if they're interested in speaking to those committees.
Thank you. We'll definitely take that under advisement. Thanks.
That huge report, and maybe you'd be so kind as to share the links with trustees, because we have new trustees who didn't have that. That was a great report, one of the best I've ever seen from the board. But the other group, marginalized communities, their students are underrepresented and gifted. There's some evidence that they're overrepresented in the behavioral exceptionality. So I guess my question, I'm wondering if we're going to be doing it's universal, there's been speculation that some of the students in behavioral are misidentified and gifted and they're acting out or whatever. Would this universal screening tool, if they had been sort of identified as having behavioral issues, might this point out that there's other contributing factors to their behavioral issues, and would this universal tool potentially be able to not necessarily identify it, but trigger some other thinking around that student?
Dr. Plouffe may want to jump in, but yes, that is the intention in terms of using this as a tool to look at different ways to think about students. And in your example, Trustee Ellis, it might be as it relates to behavior, but also to help identify early those students who might have a potential struggle emerging earlier and allow us to intervene in a way that we're not necessarily seeing with our current processes. Dr. Plouffe, I don't know if you want to add to that.
No, that's perfect. Yeah, that's exactly it, right? We would just want to learn more about the student's learning profile so that we can program effectively and hopefully, prevent some of those behavioral concerns that emerge.
Thank you. It's all my questions, and I support a universal tool for equity and other reasons. So good work and continue on. Thanks.
Thank you very much. And at this time, it's 10:30, so we need to have the 10:30 vote. As just reminding everyone that we need 8 of 12. There's 12 still here, 8 of 12 to continue. And so I'd like to call a question that all those in favor of continuing? And opposed? Okay, so that passes. And I think we have Trustee Campbell next on the list. Trustee Campbell?
Thank you very much, and thank you for the report. I'm especially pleased to hear, again, there'll be benefits potentially for all students. I think that's really important. I'm also pleased, if I understand correctly, that whatever the test results are, they are not in themselves going to be determinative. They'll be evaluated along with other evidence, and there'll be further stages of seeing the nods. Thank you. And I very much appreciate the local norms bit. I think Trustee Ellis touched on it. I'm assuming that in the report it's simply provided by way of example to suggest local norm might be an entire school. And I guess, I mean, it's probably an obvious thing to you folks, but I'll mention anyway, because I'm just concerned. I suspect, and I think we have initial data to suggest this, that there may be important differences by program. And if you have schools with mixed programs, right, then maybe you shouldn't be looking at the school, but, maybe the program within this, what have you. As well, of course, no group is monolithic, right? It's the old trap. There can be highly advantaged, Indigenous students, and lots of Indigenous students that aren't. And so, ideally, but I don't know if you have the research to back this up, you'd have some kind of link in terms of like the social determinants, which negatively impact findings of giftedness, and where there's intersectionality, you'd be able to take that into account. It's an ideal. I don't know if you can or not. Just put it out there. I do have a question though, so there's just comments and that is, though I get that you'll be able to replace some language questions with visual prompts and this kind of thing. I read the report, but do we feel that this will be sufficient to overcome the challenges of ELLs and others who may be struggling that way? And if we're administering in, say, grade 3, grade 4, are we going to be able to overcome, though I understand if it's too early, it might be an imprecise determination, but is social advantage baked in by grade 3, grade 4? And I guess one of my concerns is that we may go to all of this effort and find we're not actually moving the needle in terms of more equitable findings. We're just generating more gifted students. So I was sort of wondering if that's a danger that you've considered, and that's a genuine question.
Thank you. And through you, Chair, I'll turn that over to Dr. Plouffe.
Yeah, and I think there's definitely, we have to be really careful, right, with the information that we do collect and how it's used. And so generally the research supports the idea of multiple informants, right? So many different, you're gathering information from many different avenues in many different ways, right? So we can also be looking at things like work samples. Another thing they talk about is, you can use people can access certain services by using local norms or national norms, right? So having flexibility in the information that we have about a student coming in and really using that information to individualize the programming. So maybe, going straight to a gifted program isn't going to be the best fit for that student, but maybe they're going to benefit from enrichment in certain areas, right? So that's where some of those ability profiles can become really helpful as well, because really we want to focus on the programming and effective programming for all of our learners. And along the way, we might find that, there are these gifted learners that are emerging that we might not have otherwise come across if we didn't have some of these other pieces of information through the CCAT. So, but it's definitely a very valid point that we need to be mindful of. And again, it also comes back to the other thing I had mentioned earlier about the match between the information that we gather and then the type of programming. We want to make sure that there's alignment there, because if we're, looking at a student who maybe has English learning needs, and then we're putting them in a highly verbal gifted program, that's not going to be necessarily a very good fit, right? So we have to make sure that the information that we're gathering matches the programming. So that's definitely something that we're thinking about through this process, but it is very complicated and there's a lot to learn. So that's definitely something we're considering.
Very much appreciate that. I won't take much time. I noticed that in the great, thank you very much. Sorry to run on. In section 11, it refers to consideration will need to be given to district level staffing to support the annual administration of the assessment, and an estimate isn't provided. And I'm sort of looking for a forthcoming report. Hopefully we get some kind of a ballpark idea of what the true cost of this is actually going to be. And I look forward to that, because at the end of the day, if we end up generating simply more advantaged gifted students at great cost, I don't know if it will have been worth it. But anyway, thank you.
Thank you very much, Trustee Campbell. And I believe I did also see Ms. Lamba's hand up, but is she still around?
I am. If it's going to come to ACE, I'll just take it to ACE. I know you have another board meeting coming up, so it's okay.
All right, thank you very much, Ms. Lamba. Really appreciate that. So seeing no further items on this, no further hands up, let's move on to information items, report from OPSPA. Trustee Boothby, is there any report?
No, Chair, not this evening.
Okay, thank you very much. New ministry initiatives. Any new ministry initiatives, Madam Director?
No, Chair, there are none tonight.
Thank you very much. OSTA update. Any OSTA update?
Yes, Chair Penny, on April 26th, there will be the public meeting that trustees are invited to attend. So just for that update.
Okay, thank you very much. And moving on to new business. Any new business? Trustee Campbell?
There we go, microphone. Very quickly, Mr. Chair, I'd appreciate a staff comment at some point on whether we and or OSTA, or maybe they could be encouraged, maybe we want to do it, can provide advice and guidance to parents and to staff as to appropriate walk to school ages. It's become especially a bit of a hot topic during these COVID times. You know, what's appropriate for a child will vary by circumstance, but in general terms, solo, in a group, not at all. I'm getting some feedback that this would be important information and guidance for parents. So I look forward to at least a comment at some point. Thank you.
Okay, at some point in the future, I think actually those guidelines are more or less already established, but I'll leave it up to you to
I haven't been able to find them on OSTA site or our policy, but could be.
Okay. Thank you. And so I take it that the director has noted that. And moving on to Trustee Fisher, do you have an item?
Yeah, thanks, Keith. I wasn't sure if I should bring it up now or under the director's report, but I'll bring it up now. I think we've all seen last week an email from concerned parents about the ongoing discussions about the fall planning, and we also saw an op-ed from a student of ours in the Citizen. And you know, I'm just flagging the concerns that have been raised about the timeliness of responses back to some of our parent community and our students. Obviously, you know, when you read reports of that in you know, sort of the public newspaper, sort of reminds me that we need to be doing our level best to try and respond as fast as we can. Especially if it relates to our students. And I hope we're taking every effort to consider those issues that are being raised with us and responding in at least in some way or acknowledging. I think there's just a general concern that the board is not even acknowledging, I think, some of these concerns that have been brought forward.
Thank you very much. And do you wish to comment, Madam Director?
Thank you, through you, Chair. So I'm not quite clear about specifically what that is. I do know that the items that were brought forward pertaining to the opening of school for the fall that when it was brought forward, it was brought forward several weeks ago. We recognized that clarification was required. We came back again with further information last week, Tuesday. And of course, the week was a short week. So we actually have taken forward the discussion and feedback from the discussion on Tuesday to then push out coming this week, a further update and a further clarification. The challenge is that when it is that we get repeated questions of the same type, answering each and every one of them, it becomes an unproductive effort. But what it does signal is that it's a question that is on everybody's mind. And so to that end, what we are doing is we are trying to pull together the information to communicate it. So we did that last week, Tuesday, and we're continuing with that this week. But as you have already noted, that conversation has been overtaken by the COVID conversation. And again, hundreds of emails. It isn't possible to respond to each and every one of them. But what we are trying to do is create responsive options like we did tonight, where it is that we made sure that we had a plan to bring that topic to the table and to ensure that we're broadly responding to the questions because we simply can't get to them one at a time.
No, I appreciate that. The one that I'm referring to was a letter that was submitted by upwards of 80 parents. And there was the op-ed by the student today about the student experience. And so I certainly appreciate we can't respond to every single email, but I think, when I read that email, when I read that op-ed, it just reminded me that, it's important to reflect and to communicate as much as we can back to some of these key constituencies so they feel like they are being heard, even though, we know we are hearing them, as you've indicated, but for some reason they don't feel like they're being heard. Even though that they might not like the answer, we need to at least indicate that they're being heard and that their views are being taken into account as we move forward in our own planning. Thanks.
Thank you very much. And Director has noted that. And so any additional items of new business? And seeing no further items, I think that we do have time to get the quick special board meeting in, Trustee Scott. Is that true?
I believe we do if we adjourn right away and
Yes,
our
and I
non-voting
did-
representatives. I believe we stay in this same connection for this special board meeting.
And I declare the meeting adjourned and turn it over to you, Trustee Scott.
Thank you very much, Vice Chair Penny. So I would like to call our special board meeting of today, the 6th of April, to order and acknowledge that we are meeting tonight on the traditional territories of the Algonquin people, whose enduring presence on this unceded, unsurrendered territory is recognized, and we appreciate the Algonquin Nation hosting us on their land. Looking first for a motion to approve the agenda. Trustee Campbell, your hand is up. Are you moving the agenda for special board?
Apparently I am.
And I see Trustee Schwartz has her hand up. You are seconding. And I will ask if there's any discussion on the agenda. Seeing none, I will call the question. All those in favor of the agenda as presented? And opposed? And that motion is carried. And now over to Vice Chair Penny for his report from Committee of the Whole.
The Committee of the Whole did meet this evening and recommended two motions by Trustee Boothby, which I will second. And I'm going to read them out extremely quickly but thoroughly. That OPS will recommend the Ministry of Education with Education Equity Secretariat as a priority, explore and develop an action plan with the following elements. That OPS will advocate for the ministry to provide school boards with a dedicated funding for an array of much needed supports best configured to meet each board's needs, including but not limited to additional teaching staff to provide immediate evaluation of learning gaps using tools such as PM benchmarks, additional teaching staff to provide immediate remediation of identified learning gaps, additional mental health staff to provide immediate mental health supports, and additional funding for professional development for education staff to focus on gap closing and mental health supports. And I'll talk about the second one once we finish this one. And that's concludes.
And
this item.
I believe you read out, including the part that is not included in the motion, that it actually reads that OPSPA advocate for the ministry to provide school boards with dedicated funding, etc. The other part was not intended as part of it, and I see it is correct on our e-vote screen. So I will ask if there is any debate on this motion. And if there is none, we can open the vote.
Oh, Trustee Lyra does have a vote.
Trustee Lyra?
Thank you. I've given it some thought, and I would like to move that we change the word advocate to demand.
As an amendment, is there a seconder for that amendment?
Madam Chair, the voting already started, I think, in error.
Yeah, the voting's already underway, sorry.
So like either we're rescinding votes that may have already been tabulated.
We were nowhere near the vote. We hadn't opened or
I hadn't asked for the vote to be opened. It appears in your e-scribe, but nobody should have voted yet.
Okay.
So the question is there a seconder for the proposed amendment? And I'm not seeing that there is a seconder, so that amendment fails for want of a seconder. And I will ask Manager Guthrie, please, to open the vote. And if you could share your screen, please, Manager Guthrie. And the motion is carried, 12 in favor, so it is carried unanimously. Thank you very much. Trustee Penny?
Thank you very much, Madam Chair. The board did meet tonight again on item on a motion by Trustee Boothby, which I will second, as follows: that OPS will recommend the Ministry of Education with the Education Equity Secretariat as priority undertake the commitment to all school boards to A, fund in addition to the 2021-2022 GSN, an additional grant in the amount of no less than 2 full-time equivalent research officers for school boards to use in their data collection and analysis as local needs dictate, such as hiring staff, funding third-party expertise, funding systems/infrastructure, covering costs associated with community/stakeholder engagement, and Part B, starting with 2022-2023 GSN newly and permanent fund as outlined in Part A. And that concludes my report, Madam Chair.
And I see Trustee Lyra, your hand is up.
Yes, I'm going to move that we replace the word recommend with demand, because I believe that it is time for a school board to begin to demand things of our provincial government, because they have not listened to our recommendations and they have not listened to our advocacy thus far.
And is there a seconder for that amendment? Trustee Bell, you are seconding the amendment. technically speaking, we should have allowed Trustee Boothby introduction on this. Trustee Boothby.
Hi, in the interest of time, I think I said it all in the committee of the whole meeting that wasn't so long ago, but I just will address the issue of demand and just reiterate that the money is actually not ours. We do need to advocate, and we do need to ask the Crown essentially for the money. I'm not sure what the difference between demand and ask is for. We need to work with the Crown, and Trustee Penny and I certainly will advocate and have advocated strongly at OPSPA that we engage in meaningful and forceful discussions with the Crown, but I don't believe demand is something that we can actually do. I'm not sure what it means in this context. Thank you.
Trustee Penny?
Just want to add that if you put the word demand in here, then it unfortunately will reduce the chances of OPSPA accepting it, which is the first hurdle. I think that when it comes to that's just the politics of the situation. I totally understand Trustee Lyra's viewpoint, and it doesn't mean I actually agree with her that that's probably the case. It's just the first hurdle to get this recommendation through is to get it through OPSPA. So.
And I have no other speakers to this. Trustee Lyra, did you want any wrap up on your amendment?
I would.
Very briefly, please.
Yes. So we have advocated, we have requested, we have asked, and as trustees, we sometimes get demands from community members or from organizations that we do something differently. To demand is a stronger ask than to ask. It's a stronger language. And at some point, we must escalate our language because our current advocacy has not been effective to date. I understand Keith's point about pragmatism and that it is less likely to be accepted by OPSPA if it uses stronger language, but I do not believe that we should abdicate our responsibility to ask forcefully even if others are unwilling to do so.
Thank you for that. So I will call the question on the amendment. All those in favor of the amendment? And those opposed to the amendment? And abstentions? And the amendment fails. So that brings us back to the main motion, and I have no further speakers with regard to the main motion. So I will ask Manager Guthrie, please, to open the vote. And the motion is carried unanimously, 12 in favor, none opposed. And that brings us to the end of our agenda for this special board meeting. So I will say thank you very much to everyone for hanging in to get this done. And I declare the meeting adjourned.